Good morning, and welcome to all joining us today. We are thrilled to have you with us for the TruePKU externally led patient-focused drug development meeting on phenylketonuria, or PKU for short. I am pleased to be broadcasting today from Washington, D.C. area, along with our meeting moderator, Kim McCleary. My name is Catherine Warren, and I am the Executive Director of the National PKU Alliance. Today's meeting is a landmark event for the PKU community, and it is a true expression of NPKUA's mission to improve the lives of individuals with PKU, pursue a cure by expanding research, and provide education and support to individuals living with PKU and their caregivers. We hope today's meeting serves all three of these important aims. My connection to PKU was formed 13 years ago when my nephew was diagnosed. The PKU community is near to my heart. My dedication to serving and supporting this community and NPKUA's mission has intensified over the past year since joining the NPKUA staff. It's an honor to bring our community together to elevate the voices of so many people affected by PKU and to enhance understanding about the true experience of what it's like to live with PKU for the benefit of staff at the U.S. Food and Drug Administration, life science companies, researchers, clinicians, and other advocates. The agenda for today's meeting and the discussion questions that we will focus on can be found in the meeting program at the link below your video player. I'd like to acknowledge the tremendous partnership of 14 PKU and PKU-related organizations that help to reach members of the PKU community around the globe, and the 7 life science companies who provided unrestricted education grants as sponsors of the TruePKU initiative. These organizations and companies are thanked on page 9 of the meeting program. Now, it's my honor to introduce our first speaker, Dr. Jamie Rosenthal of the U.S. Food and Drug Administration joins us to provide opening remarks from the agency about how EL-PFDD meetings inform regulatory decisions about therapies in development. Dr. Rosenthal, over to you.
Thanks for the introduction and good morning. I'm Dr. Rosenthal, an allergist immunologist and clinical reviewer in the Division of Rare Diseases and Medical Genetics at the FDA. I would like to thank the National PKU Alliance for scheduling this externally led patient focused drug development meeting and inviting me to speak, listen, and learn from all of you today. Most importantly, I would like to thank the patients and caregivers for your willingness to share with all of us your personal stories and perspectives on living with PKU. Meetings such as these provide an important opportunity for the FDA and other stakeholders to hear directly from patients and their families about the symptoms that matter most to them, the impact that the disease has on their daily lives, and their experiences with currently available treatments. This is my disclosure slide. This presentation is not intended to convey any official FDA policy, and I have no financial disclosures to make. I would like to start by sharing a broad overview about what we do with the FDA. The FDA is responsible for protecting the public health by ensuring the safety, efficacy, and security of human and veterinary drugs, biological products, and medical devices, and by ensuring the safety of our nation's food supply, cosmetics, and products that emit radiation. There are multiple centers within the FDA that are responsible for the different aspects of this mission. The Center for Drug Evaluation and Research, or CEDAR, where I work, is the center that is responsible for ensuring that safe and effective drugs are available. Over the past decade or so, we have seen an upward trajectory in the percentage of drugs approved to treat rare conditions. In 2024, more than half of the drugs CEDAR approved received orphan drug designation for rare diseases. I would like to briefly discuss the process of drug development. There's a lot of focus on the approval phase of drug development, but it should be noted that approval is the culmination of a long process that extends from initial drug discovery all the way to approval. Although the FDA plays a critical role in medical product development, there are additional key stakeholders, including but not limited to developers or sponsors, study investigators, and of course, patients, families, and caregivers. This slide has a schematic of the drug development timeline. Approval depends on the solid foundation from the very beginning of a drug's development, starting with sound basic science to identify the right compound, solid preclinical studies to better understand how the drug works in animals, and to identify any potential safety risks, and finally, clinical trials in patients that are designed to evaluate the safety and benefit of the drug. The FDA does not develop drugs, but we do typically meet with sponsors throughout the life cycle of a drug and provide recommendations to them. This slide shows just one potential example of meetings a sponsor might have with the FDA. For example, in the preclinical phase, we may need to discuss the upcoming first in human studies. Issues such as appropriate doses to be used and how safety will be monitored might be discussed in those meetings. Later on, we may need to discuss trial design that the sponsor intends to use to seek drug approval. At these meetings, we often discuss issues such as appropriate patient population, dosing regimen, and outcome measures that will be used to demonstrate that the drug is effective. Ultimately, after the trial is completed, the FDA reviews all of the data and information that the sponsor submits to us to determine if the drug is safe and effective and should be approved. Then, after approval, we also have a role in reviewing the post marketing safety information. This is the information that the public, including patients, pharmacists, and doctors, report to the FDA regarding any unexpected or concerning side effects patients may have experienced while taking the approved drug. While there are two currently approved treatments for PKU, we recognize that there is more progress to be made and more work to be done to further advance the treatment and management of the disease. While the FDA plays a critical role in medical product development, we are just one part of the process. These meetings give FDA and other key stakeholders, including product developers, healthcare providers, and federal partners, an important opportunity to hear directly from patients, their families, caregivers, and patient advocates about the symptoms that matter most to them, the impact that the disease has on their daily lives, and patients' experiences with currently available treatments. We would like to hear what specific things patients look for in an ideal treatment to manage their condition. Patient perspectives can also help sponsors gain insight prior to clinical trials on how to recruit and retain patients. Patient perspectives can help elucidate what motivates participation in a clinical trial and what helps promote retention. For example, limiting the number of burdensome procedures or visits. These are just a few examples of how incorporating patient perspectives into development can favorably impact development and increase the likelihood of success of a drug development program. Your input and perspectives really help us and will also help industry and academia to move the drug development process forward and ensure that new medications meet the needs of people living with PKU. Additionally, the information you provide today will not only help those of us present at the meeting today, but since it will be compiled into a report, it can inform all stakeholders well into the future. After the meeting, there's a place where the report is placed on the FDA website where others will be able to review it. Once again, we're all here today to hear the voice of the patient, so thank you for your participation. We are grateful to each of you for being here and sharing your personal stories and experiences and perspectives. After the meeting, the report will be posted on the website listed here. I would like to finish by again thanking the patients and their families for taking the time to participate in this meeting, and we are looking forward to learning from you. I'll hand it back to the moderators.
Thank you, Dr. Rosenthal. Next, we will hear from Dr. Carrie Harding of Oregon Health and Science University, who will provide a brief overview of PKU and the approaches that he and other specialists currently use to support individuals living with PKU, as well as treat and manage the condition. Dr. Harding, take it away.
Thank you so much for that introduction. I'm very honored to be here today to review with you the current standard of care for phenylketonuria or PKU. So phenylketonuria is an inherited metabolic disorder involving the essential amino acid phenylalanine, or Phe. The main biochemical phenotype and the cause of most of the symptoms in PKU is elevated blood and tissue Phe, but the disease gets its name from the presence of phenylketones in urine, therefore phenylketonuria. Untreated, this disorder leads to severe intellectual disability and other complications. And in much of the medically advanced world, newborn screening for high blood Phe and early institution of Phe lowering treatment prevents the severe manifestations of PKU. So Phe is normally converted to another amino acid, tyrosine, in the liver by an enzyme called phenylalanine hydroxylase, or PAH. And most individuals with PKU lack PAH enzyme activity due to inherited variants in the gene encoding PAH. The liver itself doesn't really care that it doesn't have PAH enzyme activity. The liver itself doesn't suffer any adverse consequences. However, accumulating Phe in blood crosses over into the brain and through several yet really incompletely understood mechanisms interferes with brain growth and function. So I'd like to present a more contemporary case of an infant with high blood Phe at birth to discuss the current status of the diagnostic evaluation and treatment of an individual with PKU. So this is a healthy term infant with a positive newborn screen who has an elevated blood Phe that's about twice the normal level at 24 hours of life. Before initiating therapy, we first confirm the diagnosis of PKU, and we start that by performing a plasma amino acid analysis to confirm that the child is in fact hyper-Phe. In this case, his plasma Phe level is significantly higher by day 7 of life. We also perform DNA sequencing of a panel of genes associated with hyper-Phe to confirm which genetic disorder specifically is causing the elevated Phe. And also, if the child has PAH deficiency, as this person does, they may also be responsive to the drug cypropirin, which we'll talk about later. And their PAH genotype can help predict whether they may respond to cypropirin. So, just a little aside, PKU exhibits classic autosomal recessive inheritance. Both parents are carriers and they pass the gene down to their children. And since screening began in the 60s, we have good population incidence data in the US. And the incidence of PKU is about 1 in 16,000 live births per year. And within that population of people with PAH deficiency, we know of over 1,600 different pathogenic variants in the gene. And most individuals in the US are compound heterozygous for 2 different variants. So that means that there's over 3,000 different disease causing combinations. So pretty much every individual in the US actually is unique. So how do we treat PKU? How do we treat this baby? Dietary restriction of phenylalanine intake through restriction of their dietary intact protein remains the mainstay of therapy, particularly for infants and children. And the current guidelines for treatment of PKU were established by working groups of dietitians and metabolic practitioners. And they were published initially in 2014, but they've recently been updated in these 2 articles. So, dietary Phe restriction is relatively straightforward to accomplish in infants. We prescribe a certain restricted number of breastfeedings or bottle feedings with standard infant formula every day, and then the remainder of their nutrition comes from a synthetic Phe-free medical formula. We monitor their blood Phe frequently, at least weekly, and we adjust the proportions of the milk containing the protein versus the milk that lacks the Phe. But this gets tougher as kids get older, and when we have to introduce solids, there are many fruits and vegetables that we can provide it, but there's no meats, no dairy products, no typical breads or pastas that can be eaten. And there's even some vegetables that have to be restricted. So God bless the potato with too much Phe, and even French fries have to be counted. And they have to continue on their Phe-free medical formula. We do have some low protein medical foods available to replace some solids and provide some energy, but this is a very difficult, complicated dietary plan. The current treatment guidelines recommend Phe lowering treatment for life. This has to begin in early infancy. And the target blood Phe concentrations are less than 360 for all treatment groups, with 120 to 360 being the target during a woman's pregnancy. I want to point out that the upper limit of the recommended blood Phe target at all ages, is still significantly above the concentration of blood Phe for individuals who do not have PKU. So the upper limit of normal is about 100 micromolar. So why is this? It's exceedingly difficult to maintain blood feed down into the normal range with dietary feed restriction alone without risking protein malnutrition. To do this, this requires constant intensive blood feed monitoring and dietary adjustment. Historically, when feed measurements were much less accurate and harder to obtain, the treatment goals were just built in a safety buffer. And as individuals age and they reach adolescence and growth ceases, this becomes biologically much more difficult to maintain low blood feed using dietary feed restriction. So, how well does this treatment work? So the National Collaborative Study, which enrolled individuals way back in 1967 to 84 and followed them through the age of 12 years, remains pivotal in demonstrating the efficacy of diet therapy in preventing cognitive disability. So back in that era, it was still debated as to whether or not you needed to be on diet for life or even how long they needed to be on. And this study, though, clearly demonstrated that 72 children who were allowed to discontinue therapy before the age of 10 exhibited significant IQ deficits in comparison to kids who remained on diet up to the age of 12 years. So this data, along with other observations from United Kingdom and elsewhere, led to the extrapolated recommendation for diet for life, which was first published in print in the year 2000. But there are other more subtle outcomes that came from this study that presaged later data. So the mean IQ of the children who were still on diet was normal at 101, but their parents had a mean IQ of 108, and that was a significant difference. And the kids who were still on diet had lower arithmetic scores, had higher inattention deficits, and also an incidence of deficits in visual spatial skills in comparison to non PKU children. And since that time, there have been many other studies on long term outcomes that have showed this over and over again, even in people who have continued to remain on dietary therapy. And I have been fortunate to be the principal investigator on a longitudinal natural history study in PKU. We've recently published data on 73 individuals who participated in our trial, and they have ranged in age from 5 months to 54 years. Despite recruiting a cohort with a relatively good overall blood Phe control, shown as with a mean blood Phe of 470 micromolar, we still have measured impaired cognition and executive function in this group of people who are now, you know, 2 decades, almost 3 decades beyond that longitudinal or that national collaborative study. And this suggests that we still have outcomes that are less than perfect. And this is in the context of using a treatment that the dietary food restriction that, as you will hear from the patients themselves later, is difficult, socially isolating, and frequently very unsuccessful in the adolescents and adults. All of this suggests the need for novel treatments. And there's other evidence for this. First, the majority of adolescents and adults are just unable to maintain the prescribed treatment targets with dietary fee restriction alone. Second, there are increasing reports of comorbidities associated with chronic dietary fee restriction. This is typically thought to be due to the abnormal macronutrient composition of the diet. I've already introduced you to the high incidence of cognitive, behavioral, and psychiatric consequences of chronically elevated blood Phe. And finally, we haven't touched on maternal PKU syndrome. Elevated maternal Phe during pregnancy is among the most potent teratogens known. And even if the fetus genetically will not have PKU itself, the PAH enzyme is not expressed in liver until the third trimester of pregnancy. And prior to that, the fetal brain is being poisoned by Phe from the maternal circulation, and this causes irreversible damage to the fetal neuronal development. I do want to speak about a couple of currently available therapies that can be useful. I mentioned cypropirin dihydrochloride earlier. This is the pharmaceutical version of the natural BH4 or biopterin cofactor that the enzyme uses. And so a portion of PKU patients are responsive to pharmacological doses of cypropirin. In these patients, daily oral cypropirin can significantly increase the amount of dietary Phe they tolerate and will lower and stabilize their blood Phe levels. This treatment, however, still usually needs to be used in the context of a Phe-restricted diet, and very few patients actually can usually liberalize their protein intake and go off the diet. Pegvaliase enzyme substitution therapy is a new treatment that's only available to adults. This is an enzyme that's unrelated to PAH. It's a bacterial enzyme that the patient with PKU injects every day under their skin. It circulates in their blood and it eats their blood Phe. The pegvaliase treatment can successfully lower blood feed down even into the normal range, and it even allows them to stop using their dietary fee restriction. However, it's a foreign protein. Everyone gets antibodies to it, and this can cause a variety of hypersensitivity reactions, including skin reactions, joint pain, and sometimes even some more severe allergic reactions. We've learned how to manage these reactions, but there's still a group of people who just can't continue on therapy due to the reactions. There's some people who just never reach a therapeutic response due to the antibodies. This to me is the most powerful data from the long-term study of the pegvaliase, which has just recently been published. And I'm displaying here the mean blood Phe of the subjects in red over 3 years of treatment, and their daily dietary phenylalanine intake is in blue. The average dietary Phe intake is doubled, while the mean blood Phe dropped from over 1,200 micromolar down to just over 300 micromolar. Pegvaliase is the only commercially available treatment that will allow both Phe reduction and increased dietary protein intake. Coincident with these changes, the participants in the trial experienced a wide range of benefits in terms of neuropsychiatric outcomes, but I'll have to say we struggled to adequately capture and describe these experiences using the available neuropsychiatric measures that we had. So these are my takeaway messages. Early detection of PKU through newborn screening and institution of Phe lowering therapy early in infancy are critical to preserving health and global development. Dietary Phe restriction remains the mainstay of contemporary therapy for infants and children. The efficacy of dietary Phe restriction, however, wanes during adolescence and adulthood. Adolescents and adults with chronically elevated blood Phe exhibit increased cognitive, behavioral, and psychiatric disability, but the manifestations do vary among different individuals. Emerging data suggests that Phe lowering into the physiologic range with the ability to consume intact dietary protein, a goal that will require the development of novel treatments, may improve global outcomes. I thank you for your attention today, and I look forward to hearing from the other individuals in the conference today.
Thank you so much, Dr. Harding, Dr. Rosenthal, and Catherine, for getting us off to a tremendous start. It is a privilege and a pleasure to be with the PKU community today to facilitate this meeting that I am confident will lead to a better understanding of what it's like to live with phenylketonuria, or PKU. Over the next 4.5 hours, you will hear a range of experiences and expectations that people affected by PKU will share with FDA, life science companies, researchers, and others. I've had the opportunity to foster forums like this one for patient and family perspectives to inform the development and regulation of new medical therapies since FDA created the PFDD program in 2012. We've been planning for this day for more than a year and have connected with individuals whose lives have been affected by PKU in myriad ways and to varying degrees based on their age, the form of PKU they have, changing management guidelines for PKU over time, as Dr. Harding just described, and treatment advances. And as Dr. Harding mentioned, PKU was the first disease for which newborn screening became routine, and we will hear today from individuals who benefited from the early stages of the transformative change that represented. We'll also hear from individuals who are or have been participants in clinical trials for novel therapies in development and those in use today. These folks and each and every member of the PKU community is a true pioneer. In this setting of this EL-PFDD meeting, I want PKU members, community members, to feel empowered as the experts in the lived experience focused discussions we'll have today. Please hear that and take it to heart, especially as we invite your comments and perspectives at different points throughout the meeting. Allow me now to provide an overview of the meeting structure and agenda that you can follow along with, starting on page 4 of the meeting program that's available at the link below the video player. You will see there are 3 sessions, each with 2 parts. In the first session, we will focus on the symptoms of PKU and all the ways that PKU impacts daily life. We'll take a short 10-minute break and then return for the second session, which focuses on current management approaches to PKU, including a Phe-restricted diet, medications, and medical foods. We'll have another short break and then return for the final section dedicated to perspectives on future treatment and monitoring, treatment aspirations, and clinical trials. Now, for each of these 3 topic areas, we'll hear first from a series of community members who have pre-recorded testimonials on their experiences relevant to their session topics. Then we'll have a discussion focused on a set of questions you can find in the meeting agenda. And we'll begin each discussion with a group of community members joining Catherine and me live, who will help kick off the conversation with the initial comments based on their experiences. And throughout each of these facilitated discussions, we invite participants from the PKU community, individuals diagnosed with PKU, parents, siblings, spouses, care partners, and other loved ones, to contribute your perspectives and experiences. And we have 2 ways to do that at the appropriate time. You can actually call into the program at a phone number that we'll share later, and you can share written comments at any time, including now, using the form below the player window. If you're a clinician, a researcher, a member of industry, or a government staff person, your role today is simply to listen to learn, as today's program is meant to capture the patient's voice. We know this time will go by fast, so please know that anyone or anything we can't get to in the live session will be captured for a comprehensive voice of the patient report that will summarize today's meeting and will be released late this year. We also know this is a long day to be in front of a screen. If you need to step away for any part of the meeting, the recording will be available immediately after the meeting ends. You'll be able to return to it on demand as often as you'd like and share it with others. Now, let's get started with our first session, focused on living with PKU and the symptoms and daily impacts it brings. We have structured this segment to help illustrate how differences in disease management over the lifespan can affect the symptoms and the impacts. And as they say, a picture is worth 1,000 words. So we have compiled a short video to remind us how far we've come these last 70 years. This video features archival footage of Sheila Jones, the first child with PKU treated with a low-protein diet in Birmingham, England, and a video of older adults with PKU who were not adequately treated, with thanks to Kevin Alexander for this footage.
This is 3-year-old Sheila Jones, filmed by researchers at the Children's Hospital in Birmingham, England in 1952. Here she is before dietary management, demonstrating intellectual disability, lack of engagement with her surroundings, and general distress. She's filmed again after several weeks on a protein-restricted diet. You'll see Sheila is now interacting with the keys and a chair. Her mobility has improved, and her demeanor is calmer and more relaxed.
My name is Kevin Alexander. I'm 31 years old, and I have PKU. I just happened to be surfing the web and came across this video that somebody had done that they produced. They showed a few patients that weren't diagnosed.
With that historical context, let's turn to a slate of PKU community members who will share their contemporary experiences living with PKU. This segment focuses on the daily impacts of PKU, recognizing again the intertwined consequences of management on symptoms, activities, and aspirations. As we prepare to listen to the pre-recorded statements and then engage with our panel of community members in discussion, I want to honor and recognize their courage in being asked to recall and relive difficult experiences, to openly share their disappointments and triumphs alike, and to speak in a public forum like this. We appreciate our speakers inviting us into their homes for these brief glimpses into their lives. As you will see, 2 speakers in this group preferred not to be on camera, so we honored those requests. Now let's hear from Kathleen Gonzalez, age 61, in a statement read by Elena Jarecki, from Elizabeth Roper, age 49, Christy Smith, who's 42 and also a mom to 4 adopted boys with PKU ranging in age from 6 to 21, Melissa Burnson-Goulart, age 33, and 9-year-old Adelaide Lubliner and her mom, Kristen. Elena, speaking on behalf of Kathleen, please take it away.
My name is Elena Jarecki, and I serve as the Director of Research Development for the National PKU Alliance. I became involved with the PKU community as a dietitian. Today, I will be reading a statement from one of my former patients, Kathleen, a person living with PKU in San Jose, California. This is her statement. PKU runs deep in my family. My mom had 8 children along with 4 miscarriages. 5 of us had PKU. When I was born in 1964 and my PKU was discovered through newborn screening, my mom already knew what to do and started me on formula right away, as I was the youngest of my siblings with this condition. My oldest sister was born in the late 1940s before much was known about PKU or how to manage it. She had severe intellectual disabilities and couldn't sit up, speak, or do anything independently. Doctors convinced my mom to put her in a care facility, which caused my mom a lot of anxiety. She hoped to bring my sister back home one day, but sadly, my sister passed away at the age of 7. My oldest brother, Fred, was the first one of us diagnosed with PKU at the age of 2. After that, my 2 other siblings with PKU and I were diagnosed through newborn screening. Sadly, our medical records were lost, so I don't know much about our early years. Growing up, PKU really affected the dynamic of our household. My siblings and I with PKU got more attention, but we were jealous that the others could eat whatever they wanted. When I was 8, my mom took all of us off diet at the same time. Looking back, this had serious consequences. Each of us face our own health challenges. My sister is now in assisted living and struggles with memory loss. One of my brothers needs daily support from his wife. My oldest brother had recently become a victim of an online scam and is still convinced that the celebrity he is sending money to is real. For me, PKU has really affected my physical health. Around age 20, I encountered my first experience with vertigo. I had been blacking out and was stuck in bed for periods of time. I started to see improvements, returned to work, and even got to a place where I could do some traveling. When I got pregnant with my first son a few years later, at age 29, I met Elena Jarecki, a dietitian who helped me get back on a low protein diet. She was a good motivator. It was hard to tell if the diet helped at first because I had a lot of complications with my pregnancies and was still struggling with vertigo. But Elena's support made a big difference in my outlook. I went off diet after I delivered my first son. He did not have PKU, but as he got older, it was evident that he had developmental delays. He didn't walk until he was 2, and despite our belief that he was autistic, his psychologist never found enough indications to formally diagnose him. I got pregnant with my younger son a few years later, and Elena helped me stick to a low protein diet during this pregnancy as well. I went off the diet after delivering. My younger son did not have PKU either, although he was quiet, slower to react, and more introverted when he was little, and the psychologists who evaluated the boys did think he might have autism. He started to outgrow this in the middle school and eventually graduated college with honors. Both sons live at home with my husband and me. When my sons were 5 and 3, I experienced a second bout of illness and vertigo that was completely detrimental to my health. I made countless emergency room visits and started rapidly losing weight until I was skin and bones. Watching me being taken away in an ambulance time and time again took an emotional toll on my youngest son. No one could figure out what was going on with me. I felt so hopeless that I considered taking my own life. The collective experience across my family has led me to realize the importance of keeping my Phe levels in control, but my health is still far from perfect. I deal with chronic vertigo and can't exercise or ride in a car for long, so traveling isn't really an option. Living with the daily challenges of PKU has also led to anxiety and depression, which I've been managing through treatment since my 20s. I'm on disability, and sometimes it feels like too much damage has already been done to fully recover. I do worry about aging with PKU. Seeing my siblings' struggles reminds me of how serious this is, but I focus on what I can control, staying in care, sticking to my diet, and doing the best I can with the tools I have. Thank you very much, Kathleen, for sharing this statement.
My name is Elizabeth, and I'm a person living with PKU in Gloucestershire, Great Britain. My experience with PKU has been the biggest trauma of my life, more than losing my dad, more than my parents' divorce. When I think back on the early stages of my PKU journey, I think of a moment where I was standing in a red phone box in the middle of the city, not knowing who to call for help, but no sound was coming out of my mouth and no movements were happening in my limbs. I was living behind a pane of glass. For me, PKU has never just been about food, it's about managing brain chemistry. I was diagnosed at birth after a heel prick test. When the results came back, my mum was kept in hospital, surrounded by people who knew nothing about the condition. Days later, a specialist reassured her that I'd be fine so long as I followed a strict medical diet. We started attending clinics with cartoon characters on the walls. That was my waiting room for the next 28 years. Growing up, my parents took on the strain, checking my Phe levels, packing me strange school lunches with boiled starchy bread and gherkins. At parties, I brought my own food. I don't remember childhood as traumatic. That changed in my teens. While studying for exams, I started relaxing my diet. It was easier and more convenient. No one had ever explained the impact of high Phe on the brain. I thought you were either fine or unable to walk. I didn't know there was a huge set of in-between symptoms of altered brain chemistry and mental health problems. I became agitated and forgetful. I couldn't catch the bus on time. I felt paranoid about friendships. At my waitressing job, I once kicked a pedal bin across the kitchen because I just felt so randomly angry. Looking back, I was self-medicating. Music and shopping helped me cope with the depression brought on by Phe blocking my dopamine and serotonin. At Reading Festival in 1992, everything shifted. After a weekend of soya burgers and inconsistent food supplements, I suddenly lost all sense of awareness while watching Nirvana. I could hear the music, but I felt emotionally and physically disconnected, like a robot in a crowd. I stood hugging myself, unable to explain what was happening. I didn't fully wake up from that state for 4 years. Soon after, a friend told me my boyfriend had cheated on me with men. The aid, the AIDS epidemic was everywhere at the time, and I spiraled. I waited 2 weeks for an HIV test in a disassociated haze, convinced I was going to die. When the test came back negative, I felt relief, but it didn't last. I was stuck in a loop of health anxiety. At university, I hit another low point. The accommodation was awful. When I got the flu and my Phe levels skyrocketed to 1100, I broke down completely, crying non-stop, unable to function. My dad came to bring me home. That's when I began to understand I had to get my levels down, and that anxiety was part of it. I started opening up. I found a kind boyfriend and made new friends, but I still struggled. I was always in trouble at work for being late or forgetting things. I lived with a promiscuous woman once and panicked so much about HIV that I went for another test just because I borrowed her earrings. Despite all of this, I built a career. I completed an MA in heritage management. I worked in nature and history and found a man I loved, got married and had a child. I found spirituality and a sense of peace through meditation, but high Phe levels were still impacting me. My memory suffered. I was forgetful and unfocused. I kept losing contracts. I was sent on courses about time management and assertiveness, skills that were never the root problem. Between 2004 and 2016, my obsession was coffee. I was drinking takeaway coffees with 9 grams of protein each and waking up in a fog. The only thing that seemed to help was more coffee. I was self-medicating with caffeine and shopping, still not 100% sure of the link between mental health and Phe. Then in 2016, everything changed. A new PKU consultant saw me crying in clinic and asked, "You don't think you've got depression, do you?" She explained how poorly managed Phe could cause depression. I read an article about how PKU patients can only access 30% of the dopamine that normal people can. I continued to read research indicating the lack of neurohormones in PKU patients is overlooked in our daily care. My medical team reviewed my Phe levels and we cut my allowance and started antidepressants. Within 2 weeks, I felt like a new part of my brain had come alive. I had lived with a low-level depression my entire life, and without realizing it, it was gone. For the past 11 years, I've been on antidepressants. I've stopped making self-destructive decisions. I made it through COVID without a single obsessive thought. I've since developed ME/CFS, and some days I can't move. But I'm still happier now than I was in my 20s. I was sick for 2 decades, and no one connected the dots. I'm proud of myself. PKU has defined my life in most negative ways, but I fought for it to mean something. It has brought me my faith and untold self-awareness. I just wish that I was younger. I wish when I was younger, someone had looked past my diet and put my mental health into the bigger picture.
Hi, my name is Christy Smith, and I live in Tucson, Arizona. I am 42 years old, have PKU, and I have adopted 4 sons with PKU as well. I was diagnosed with PKU through newborn screening in the early 80s. My parents were thrown into an emotional roller coaster those first few months until they established care with a doctor who understood the latest research regarding PKU and assured my parents that if I followed Diet for Life, I could achieve the dreams that they had for me. Everything I ate was fruit, vegetables, or specialty low protein recipes. My parents said that my behavior could tell them when my level was high, and as I got older, I described the feeling as possessed by rage. My parents were told that the only way to tell when my level was high was through a blood test, but now the medical community recognizes that there are signs and symptoms of high levels that can be recognized. Despite all of these struggles, my parents lovingly supported me, taught me, and provided me with the best nutrition possible. Middle school and early high school were rough because I was experiencing symptoms that turned out to be caused by high Phe levels. I was having headaches, anxiety, and poor sleep, and overall executive functioning issues. When my levels are high, I can sleep 12 hours and still wake up exhausted because my sleep is just restless. My struggles with executive functioning include time management, problem solving, adapting to unexpected obstacles, and even my mood. Still, as an adult whose blood levels have been in range for years, even a slight increase in my level, even if it's still in the therapeutic range, will throw me into these symptoms. There's no correction dose like a diabetic. Only diet changes and time will fix a high blood Phe level. Thanks to the internet, as a teenager in my first few years of high school, I was able to talk to other teens and adults with PKU. This became an inspiration to me, and with the help of my parents and dietitian, I was able to bring my levels from constant 13 milligrams per deciliter down to the therapeutic 2 to 6. At one point, I was even below 1. My anxiety decreased, my sleep improved, and my executive functioning struggles didn't disappear, but they definitely lessened. With lower blood Phe levels, I felt empowered. I finished high school with a 4.1 GPA, earned an academic scholarship to a 4-year university. I finished college with 2 bachelor's degrees, one in public health and one in nursing, and rock the PKU life most days. I have worked as a nurse in various capacities for over a decade and a half.
I was the founding president of our state's NPKUA affiliate. I'm a lay leader with middle schoolers at my church. I'm a wife of almost 17 years to my amazingly supportive husband. But perhaps the most rewarding but challenging job I have is that of a mother. All 4 of our boys have PKU and were adopted from orphanages on the other side of the world. We adopted them at ages 2, 2, 9, and almost 14. My oldest was at an orphanage that didn't understand the importance of PKU treatment. When he was 14 at adoption, he barely talked, he couldn't bathe himself, he had no sense of safety, and still to this day struggles with managing his task lists and time management skills. He has had 7 years of great PKU treatment now, but still has and always will have moderate intellectual disability and still functions in many ways as a 6 or 7-year-old instead of the 21-year-old he is. He hopes to get a job soon, but he will need vocational rehab to help him learn that job. And he dreams of living independently. So we're looking at building a guest house in our backyard. And even so, he's a long way off from being able to manage even that small house under our own watchful eye. But he has accomplished many amazing things. He has learned to read at about a second grade level. He can hold a conversation when he's in a familiar setting. He has a best friend, and he understands the basics of keeping himself safe in a kitchen or walking alongside a road. And he has a hilarious sense of humor. With his current treatment, he rarely has high levels, but we do sometimes see his anger and aggression heighten when he has even slightly elevated levels. Our other children are now 6, 12, and almost 12. Our younger 2 are only 3 months apart in age. Their orphanage knew about their diagnosis when they came to the orphanage as infants, and they were provided PKU formula and low protein specialty food. They have their struggles, but are intellectually on par with peers. They play sports, musical instruments, have friends, and are caring and compassionate people who have and will likely attain their goals of becoming author, illustrator, engineer, and chef. Some days we have amazing blood levels and are on our A game with regards to being on task with work, chores, and studies, managing our time and controlling our emotions. Other days, one or more of us are just off. Our levels fluctuate not only because of the protein we eat, but also the amount of calories we do or don't consume, illness, activity level, growth spurts, and hormone fluctuations. There's never a dull moment in our household. Thank you.
My name is Melissa Burns and Goulart. I am 33 years old, a registered dietitian, and an adult living with PKU. I was diagnosed at 10 days old. My parents received a phone call stating they needed to get me into clinic immediately, and they had to learn quickly how to manage my diet and navigate all the challenges that this comes with. There wasn't much of a community for them to lean on, and I didn't meet another person with PKU until I was an adult. I was started on metabolic formula right away, and this has been a staple of my diet my whole life. My parents involved me in my diet management starting as young as 6 years old. This included making my own formula, baking my low protein foods, and tracking my food and fee levels. By the time I was in high school, it was my full responsibility to manage my PKU. Kuvan actually became available when I was in high school, which was often discussed at clinic appointments. However, I was told that individuals with classic PKU are less likely to be responders. And this concerned me because I was fearful about eating new foods I may like and then be told I can't eat them anymore. Trying this medication felt like opening Pandora's box with no guarantee that I'd be able to enjoy a liberalized diet. My Phe levels were all well managed, and I was content with my formula and diet regimen, so I opted out. College was a different story. Advocating myself was challenging, and the college I attended didn't have special programs to pay for medical food or accommodate special dietary needs. I snuck a toaster oven into my dorm room so I could cook my frozen medical foods. I worked in the dining hall and made friends with the chef so I could make my low protein pasta. When I joined a sorority and moved into the house, my medical food had to be stored in the kitchen, which was locked between meals and on weekends. This was the first time I experienced being off diet in my entire life. And when you're off diet, it's really hard to notice the impacts on your own. My parents started to recognize subtle changes in my mood and attitude and asked me about my diet management. I never even made the correlation that everything I was feeling and experiencing at the time was PKU related, since I was still drinking my formula and trying to eat low protein foods. I went home for the holidays and they essentially reverted back to helping me with my diet as if I was a kid again, which was such a relief and source of support I was lacking at school. This was a huge learning experience in advocacy and the start of how to detect when I may have higher Phe levels. This is hard because a lot of the symptoms I experience are also just part of being a person. It often feels like a guessing game of whether it's because I'm hormonal, didn't sleep well, or if I had a bad day at school or work. I've learned that the only way to know for sure is to check my blood Phe levels and keep in mind that the self awareness and discipline of checking Phe levels requires executive functioning skills, which are often the first thing to slip. It honestly takes so much support, discipline, and frankly, extra financial investment to get back on track and stay on track with diet. I'm very grateful that I was fortunate enough to be able to do this. Having PKU has also greatly impacted my life in regards to having a family. Once I became of childbearing age, I was constantly receiving education about the importance of diet management to prevent maternal PKU syndrome. By the time I started my family planning, I had so much fear and anxiety about diet management, despite having consistent normal Phe levels. During pregnancy, there's so many hormonal and diet changes that it's very hard to know what is pregnancy related versus rising or falling Phe levels. Pre pregnancy, I was checking my blood levels once a month, and this increased to twice weekly. I would have to wait 1 week before getting my results, and this was such a significant delay for me to make any timely changes. By my second trimester, I was steadily increasing my protein intake, and my tolerance went from 7 grams of protein per day to 30 to 35 per day. This invited more stress and anxiety in my regimen as I was trying to navigate my rising tolerance, the mental toll of eating foods I've never been allowed before, and the caution in choosing which foods to include in my diet because I knew this was short term. I was worried that becoming too liberal with my food choices would make it harder to transition back to a lower protein diet, and I'd learned that this was correct. The challenge of being postpartum, becoming a new mom, trying to manage my diet with decreasing protein tolerance was one of the most challenging experiences I've ever had, and it truly wouldn't have been possible without the support of my husband, family, friends, and maternal PKU mentor. For a long time, I have been in the group of people who would rather not take medication for now and have been content with my diet. Drinking my formula is such a constant part of my life, it would feel odd for me not to have it. Eating more protein has never been a goal of mine, but now that I've experienced some diet liberalization, I'm interested in exploring this more to allow for healthier food options and minimize the impact of having to make multiple meals at dinner with my family. However, I don't want to trade this for the risk of having significant side effects or invasive daily procedures. Finally, my response to the question about things that I can't do at all or as fully as I'd like to relates back to the point about how much emotional and financial support it takes to maintain my diet. When my husband was in the middle of a job search, I had to make a list for him of the states we could move to based on the different policies for coverage of medical food and formula. Not everyone has this choice or option, but having PKU significantly dictates where we can live. Thank you so much for this opportunity to share with you my experience with living with PKU. This is such an important meeting, and I'm very glad to be a part of it.
Hello, I'm Addie Loveletter. I live in Mount Sinai, New York with my mom, my dad, and my brother Dominic. I'm 9 years old and I have PKU.
Hi, I'm Kristen, and I'm Addie's mom. And we're really excited to speak with you about how PKU affects our lives. Addie, what are some ways PKU affects your life?
When my PKU affects my life is probably when I have to buy lunch at school, and this has actually happened, true story, a couple days ago. I dropped my food on the floor and I had to wait almost 20 minutes to have my food made again. I wish it could happen faster, but it's special food, so it has to take longer.
So I think right now I'd like to show everybody what it's like to make a snack for you to bring to school. All right, so let's show everybody. What's this?
That's a scale.
And then what do we do to make our snack?
Normally, we turn on the scale and make sure it is back to 0 grams.
Okay. Then we take our bowl,
And we put it on the scale, and we also zero that again.
and then we have to think about how much of the snack that we're going to eat and how much Phi would be in that snack, right?
Yeah, normally we do about 25 grams of pretzels, which is 5 feet.
And that easily fits into your allowance for the day, right? So then why don't you make the snack?
So I normally like to take about a handful and just kidding again. That's 12 grams of pretzels.
And you just have to be careful that you're measuring exactly how many grams that you can have.
Okay. 21. 25.
Perfect. So then you would put it in the bath and you take it to school. So then I think you have a question for me.
Yeah. How does me having PKU affect your life?
So obviously it does take a lot of time and preparation. For instance, the last time that we went on vacation, we were going on a cruise ship and we had to call about a month in advance in order to make sure that we could bring your special foods onto the ship and that the ship had the ability to cook your special foods.
Oh.
Yeah, so there's a lot of preparation that goes into managing this diet, both on your end and with me, right?
Yeah.
Okay. So, Addie, is there anything else that you want people to know about PKU?
If you've ever approached a person with PKU saying like, how can you not eat this? For me, it makes me feel very self-conscious and anxious because you're asking me why. And I don't like that. It just makes me feel weird and like an outsider.
I think a lot of times anything that makes you different can make you feel bad about yourself. But really, in our everyday life, we try to think about PKU as a positive thing too. It's giving you a lot of confidence and a lot of ability to talk to many different people,
It
right?
definitely has.
Right. So we just want to thank you all for letting us be a part of the True PKU meeting. Thank you.
Thank you.
Wow, Catherine, that was a powerful set of testimonies illustrating a range of experiences that truly reflect how important it is to understand the context of how an individual with PKU's health status today is affected by their stage of life and how consistent their management has been over their lifespan. Catherine, what's your perspective on what we just heard?
Yeah, so often when speaking to people who are aware of PKU but not personally affected by it, we hear, well, for PKU, there's newborn screening, there's dietary guidelines, medical treatments. Isn't that one of the diseases that's considered to have been solved? Yet it's clear from the experiences that we've just heard from all age groups that PKU still has major impact on people's lives, adults, teenagers, children, and caregivers alike.
Thank you, Catherine. That is so true. As we bring on our panel of community members with us, I will remind other community members, people living with PKU and their family members, that you can share your experiences by dialing in. The phone number is 1-703-844-3231. Again, that phone number is 1-703-844-3231. You can also submit written comments using the form below the player on the webpage where you are right now. We heard from the presentations about a wide variety of symptom impacts. And to start our conversation about the most burdensome symptoms of PKU, let's meet our first panelist. Do we have the panel coming up? There they are. Hello, everyone. Good to see you. So let's invite Les Clark from Fort Worth, Texas, who is 46 years old. And Les is in that cohort of adults who experience changing guidelines for maintaining a low-Phi diet during childhood and shifting goalposts for how long they might have to stay on that diet. Les, please introduce yourself with a little background on your PKU experience and then respond to the question of all the symptoms that you experience because of your condition. which 1 to 3 symptoms have the most significant impact on your life?
Right. Thank you and good morning. I was born in Nebraska back in 1978. When my newborn screening test turned up positive for PKU, there was some skepticism among my medical team whether that was accurate. So it took 3 weeks to redo the test and confirm that my diagnosis was indeed PKU. I was put on the low protein diet as soon as that positive test for PKU was concerned. And my parents, over the first few years of my life, put a lot of effort into finding resources, the special foods, the medical foods and formulas that I needed. Back then, there weren't nearly as many choices as there are today. But I was on diet. I got made fun of kids in elementary and middle school because I ate different things, and some of the foods and formula were different or smelled bad. And that was an interesting experience during middle school when being special and different wasn't really what you wanted to be. So it was an interesting experience. But the one thing back when I was a young child, the research at the time thought that the brain was done developing about age 6 or so. So the thinking was I could go off the low protein diet at age 6. Well, as I got closer to 6, there was more research done, and then that milestone became age 8. Then about the time I turned 8, there was more research like, well, maybe the brain isn't done developing until age 12. And then by the time I got to 12, the research was, diet for life. PKU symptoms occur at any age. It's not just a childhood disease. So switched to diet for life. This was not something that I wasn't counting down until my 12th birthday and I could go eat whatever I wanted. But I'm sure my parents were looking forward to not having to deal with special foods, special medical formulas, things like that. So that was my experience. Like I said, I don't remember counting days or anything, but certainly diet for life is a big factor in my success and my ability to be a functioning member of society. As far as the symptoms of PKU that I experience, I try to keep my levels in the treatment range, which can be very difficult. But when I do have too much protein, it really affects my moods. It affects my ability to think. It affects my attention span and executive functioning. When I have too much protein, over time, I feel the effects. I become anxious. I can feel depressed. I get kind of moody. My attention span is limited. My thoughts are kind of all over the place with brain fog and things like that. So it's difficult to realize you're slipping into some of these symptoms of high protein because we have bad days. We don't sleep well. There's other things going on in life, so it's sometimes hard to notice that it's due to high Phe levels, and that's what makes it so difficult. And that's probably why people go off diet. They slip off the executive functioning. Staying on the diet is hard. And when you have these symptoms of high Phe levels, it's even harder to get back on track when you have to plan and manage food and formula and things like that. So it really does impact your entire life when your Phe levels are too high.
Yeah, thank you so much, Les. And what I'm hearing you say is similar to what we heard from Melissa and Christy in their statements as well. Just the sort of swirl of symptoms that comes as soon as you might stray from the diet or have something you didn't know had protein or Phe in it, and then you get into a vicious cycle of trying to get back. Any of our other panelists want to add to Les's list of the most burdensome symptoms of the condition?
I also get headaches, and it's hard to go through each day. I have to watch what I eat throughout every day, and there are times I haven't eaten and it's hard to think. So if you don't eat right, you can't think right.
It's a good mantra, Diane, to share with us. Rhonda, any thoughts from your experience that we'll hear a bit more about, but do you want to weigh in on this question?
Well, I think, again, having sons that are now in their 20s and 30s, I've seen a lot of different PKU community members. And the interesting thing is there's so many variations on how they feel and what they feel when their levels are high, from just feeling off to being in bed and being full depression. So I think the interesting thing is it's not everybody is not the same how they feel. Everybody is different when their levels are high, and how high is also a difference. Some can be higher than others and not feel as much. So I think, as we'll hear today, but I think that's pretty important with our community.
That's a really important point, just the heterogeneity and the variability between individuals. And it's such a dynamic picture to paint of this community. Catherine, are there comments from folks participating online today?
There are. There's one I think that really says a lot. So Lori in Texas, I think, is talking about maybe her son, but she says his Phe levels have been high for so long that he doesn't realize or believe there are complications that hinder his daily performance due to high Phe levels. So he doesn't even realize it.
Unless you made that point, how hard it is to recognize it, and we heard it from Melissa.
Yep. We also heard from someone in Australia. Many symptoms other than elevated Phe levels impact daily life: fatigue, mood, body aches, hunger, gastrointestinal discomfort, and weight management. And then lastly, Felicity in California talks about, she says, our son has food aversion issues.
I can imagine. It's hard to keep kids interested in the limited range of foods that they have to choose from.
Absolutely.
Any other thoughts on this question of significant symptoms or impacts? All right, well, let's move to another question that we would like you to all think about and respond to. And as we heard from Kathleen and Elizabeth in their statements, the effects of PKU are present daily and also have longer-term implications for career, family, and more. Melissa Vachuska joins us to start a conversation about the ways in which PKU affects daily functioning, roles, relationships, and long-range goals and dreams, not only for the person with PKU, but their caregivers as well. Melissa is mom to 2-year-old Rowan, and they live in Plymouth, Minnesota. So welcome, Melissa. Please give us a little bit of your background and then address the questions. Are there specific activities that are important to you, but that you or Rowan cannot do as fully as you want to because of PKU? And also, what's a good day like versus a bad day for Rowan?
Yeah, thank you so much, Kim, for that introduction. So my husband and I had a long and painful journey starting our family. After a traumatic pregnancy loss, we had gone down the genetic testing route that revealed both my husband and I were carriers for PKU. While I was anxious with that news, the geneticist that we met with reassured us that PKU would not be life-threatening or significantly impact our baby's quality of life. So when the moment finally came that I was pregnant with my daughter, Rowan, based on their optimism, we decided not to pursue any additional testing. Life, of course, as we knew it, changed once Rowan was born. 7 days after the birth, we got the phone call. We were told that more than likely it's a false positive and that these things happen all the time and that we shouldn't be worried. I vividly remember holding back the tears on the phone as I corrected the pediatrician that I had never met before that was delivering the news, that explaining it's not a mistake, we were carriers, and I knew immediately it wasn't a false positive, and Rowan has PKU. We admitted Rowan to the hospital within 24 hours of that phone call. And the following days were an absolute blur, but the diagnosis was confirmed, and we immediately learned about formula and how to balance it with breastfeeding at the time. However, it wasn't long before we relied only on formula because the protein content was far easier to track, and giving up breastfeeding was necessary for my mental health. I'll say postpartum and a rare disease diagnosis were a lot for me to handle. Fast forward to day 10 of Rowan's life, we got connected with the NPKUA and found the community that we never knew we needed so desperately. Managing our daughter's health is far from a walk in the park that we were promised by our initial care team. Weekly blood draws, detailed food logs, and the emotional strain very quickly became overwhelming. We ended up switching care teams early on and ultimately found one that we could trust. They helped us introduce us to solids within her first year. We scaled back her blood draws and adjusted her formula to food ratio. Today, Rowan is about 250 milligrams of phenylalanine. She can tolerate about 250 milligrams of phenylalanine a day and takes her PKU formula 4 times a day. Based on Rowan's mutation, Rowan is expected to respond to Kuvan, and we're now gearing up for a trial of that. While we're hopeful it will increase her Phe tolerance, the preparation, of course, has been stressful. We've increased her protein tolerance to test out her tolerance and going to be reverting back to weekly blood draws. All of this on top of navigating toddlerhood has been, like I said, a lot to handle. We're trying different fruits, vegetables, low protein medical foods, but like all 2-year-olds, Rowan's preferences can be unpredictable. While Rowan is excelling in meeting her developmental milestones, this achievement has not come easily. I'd say the mental toll of managing every single bite that she takes and keeping up with her appointments and the weekly waiting game of hoping that her levels come back within range, and just the constant fear of always wondering in the back of my head is she falling behind on any growth benchmarks has been probably the hardest, most unspoken burden of our PKU journey. I returned to work several months ago, but I just couldn't imagine working while we were adapting to our new normal, along with just the mental exhaustion that came along with it during those early critical months. And despite the difficulties, though, Rowan loves her care team, and she's to the point where she helps us measure her food, and she will enthusiastically yell, "Oh, too much, Mama," and she'll take one little low protein noodle and put it back into the box. And she helps scoops her formula every single morning into her blender bottle with me, and she'll even choose which finger she wants her blood draw to be done on. And these small victories, of course, mean just the absolute world to us. And I'll close by saying that I just wish, and my hope for Rowan's life is that it's not defined by her managing her PKU, but also her joy and curiosity and experiences that she has yet to embrace. And then, Kim, to go back to your question of specific activities that are important to us that we cannot do at all or fully because of PKU, I would say for us right now in our journey, it's any impromptu event, especially ones that are food centered. I've learned over the past 2 years just how much society really revolves around food, and that's been tough. I look at family birthdays or family vacations, birthday parties. I look at even getting a small size French fry through a McDonald's drive-through requires planning for our family. And we're a family that enjoys traveling a lot. And while PKU has not stopped us from doing that, it certainly has changed how we are doing it. Of course, it just requires a lot more planning, a lot more just mental preparation to do anything these days. And then as far as a good day, I would say a good day for us starts the night before, right? It starts that we have already logged everything from that day, that we have prepped all of her food, we've weighed, we've cut it out, we've logged how much Phe. A good day for us is also no formula strikes or refusals, and that she gladly takes her milk. No last minute invites. This is the most weirdest thing to say, but just no invites to, hey, you want to go out for dinner? That makes us have a good day, is just if our plan goes according to plan. And that Rowan doesn't notice any differences in our plates. She's to the age where she starts saying, "Oh, Mama, what are you eating? What's Daddy eating?" And that just is hard to hear at this time in our stage. And overall, when PKU feels manageable but not overwhelming, would be a good day.
Thank you so much, Melissa, for giving us that window into your life and Rowan's life and just all the ways in which you are affected by her condition. And it really helps build on what Kristen shared in her little video with Addie. And I could see flickers of recognition across your face, Rhonda, as Melissa spoke about those early days and weeks and years. I'm sure that took you back to when Casey and Brady were young.
It did, and it's funny that it seems so minor, but I remember that it was one of the first birthday parties that Brady went to, and he's 25 now, so it's a memory a long time ago. But and they brought out the cake, and I said, no, 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 he can't have cake. And poor Brady burst out in tears and was just crying. And we left the party because I just was so distraught. And so clearly that still is with me after many, many, many years.
And the statement you made, Melissa, about recognizing what a food-centered culture we live in and how many things revolve around food is certainly something we have heard in the planning for this meeting, of that being just a major limitation on so many aspects beyond just sitting down to eat a plate of food, all the other things that are wrapped into that sort of, ritual that we do a few times a day when we're lucky. Les or Diane, would you like to weigh in on this question about specific activities you can do or can't do? And I'll just make another plug for calls. We're ready for calls, and the phone number is 703-844-3231 if you'd like to join the conversation. But Diane or Les, do you want to add in your thoughts?
I was going to say, in my family, my mom and dad take the grandchildren on grandparent trips, and whether it's around the country or so, they take the grandchild and they take them by themselves, and the whole purpose is to have time with that one grandchild. And I have a 10-year-old son, Noah, with PKU, and I also have PKU, and Noah's turn is coming up. And there's big discussion on whether my parents can, if they want to even take on the diet for a week or two and be responsible. My mom did my diet, so she knows it, but they may, right now the plan is for me to go on the trip with them because of the diet. One of Noah's cousins is like, no way, you can't take the mom because it's a different trip.
You'll wreck the trip.
So just
Diane,
this is a big deal.
I was just going to say my parents did the same for their grandkids, and I was so nervous when Casey was going away for 2 weeks with my parents. Actually, they was fortunate to go to Europe, but all I know is Casey came back and said they have the best French fries over there. So it was, thank goodness for French fries. That saved them all.
I think French fries save every day.
Yeah.
And I think the thing I'd like to come back to is Melissa said, the planning and the preparation. And that's kind of been, my family's and my attitude. PKU makes doing certain things harder, to traveling, things like that. But, it should not make things impossible. So that's, we've had to adapt. We've had to carry food through airports, carry formula, on travels, which makes things interesting, requires that planning, that preparation, but, it should not make things impossible.
We heard a lot about the challenge of getting through TSA with formula and medical foods and being, taken off to the side and frisked and all kinds of things. Sounds like you've all been there in that place.
I was going to say Noah's 10, so he's right at the age where there's lots of events. And our work and school is a half hour for home, so we usually carry food in the car. But there are times like he eats a low protein food, and it's hard to carry cooked pasta in the car in case you need it. So that's becoming more difficult, just the unplanned and my friends want me to do this. I'm like, what about food? And in a birthday party in his class, he doesn't really like cake, and he'll just say, I don't want food. So he's sitting there eating nothing while everyone else is eating something, and I keep trying to get something. So anyway, he says he's fine, but I don't think he really is.
Yeah, it's got to be rough. Catherine, are there comments coming through online?
There are comments. Ellen in Rhode Island is discussing, having a social life. But one of the things that she talks about, she says they look out for, I'm blessed to have very good friends and family. They look out for me. If I'm going to a restaurant with friends, they let me pick the restaurant according to what I can eat. And, I think in the PKU journey, that is so important, the support group that you have to, get you through those hard times.
Absolutely. Well, during the pre-recorded statements, we heard a lot about how PKU changes in response to how well managed it is, as well as the challenge that management itself represents, a topic that we're going to get into in much more detail in the second segment of the meeting. But for now, I'll invite Rhonda to respond to a couple of questions about how PKU changes over time and how well she considers PKU to be managed today, based on her experience as mom to Casey and Brady, whom she's already spoken about, both of whom are now adults living with PKU, as she mentioned, as well as your broader experience, Rhonda, as the co-founder and president of NPKUA. And Rhonda joins us from Encinitas, California. Good to have you with us, Rhonda.
Thanks, Kim. And I don't know, like everybody else, I'm still pretty emotional about what we already heard today, and we've got several more hours of this. So I'm trying to be ready here. So like so many other parents that I've met over the years, we got the life-changing call from our pediatrician just days after Casey was born. And we were told not to worry because PKU is rare, and we already had a healthy son, CJ. But after the second blood test, our doctor called back and told me, stop nursing, come meet with a geneticist and dietitian immediately, or it would cause permanent brain damage. This was also before the internet 30 years ago, so we had no way of looking things up online and seeing what it meant. This was the beginning of learning about our life with PKU. And when our son Brady was born 8 years later, we were better prepared for what the PKU diagnosis would mean for him and for us. But it still was not easy. We raised both boys on a strict PKU diet and protein substitute formula. When both of them were young, we were able to control what and when they ate. But as others have said, and like we talked about, holidays, birthdays, celebrations were always tough. And we supported them by being active in sports and not letting PKU get in the way of any interest that they wanted to pursue. So, having PKU was just a matter of fact at our house, and we tried to make it as normal as possible. As they got older, however, and became more independent, it was more challenging to manage and keep a watchful eye on their diet. And I could sense when they were sneaking foods from the pantry. And when they ate too much protein, I could tell they were more anxious or cranky. And with sports after school, it was more difficult to maintain their diet. And like we said, they'd have to bring their formula with them to school and hurry and drink it before practice to make sure they had the energy to work out. Puberty was a particularly tough time because the gut changes of adolescence and growing. Both of them did feel better when they exercised, and the workouts gave them the natural boost in dopamine and serotonin that they don't get because of having PKU, like you heard from Dr. Carey. In fact, I would say that they crave the workouts and feelings it gave them, and they still do. Sending the boys off to college was a proud moment, although one compounded by fear whether they would be able to stick with their diet away from home with all the wonderful distractions and temptations of college life. When touring colleges, we actually spent time looking at the cafeterias and the food selection, and it did make a difference in selecting the schools that both Casey and Brady chose to attend. Once they were at college, we tried hard to balance our concern about PKU-related issues with other conversations when talking by phone or during visits on their breaks. And at times, we could tell when they were more anxious than usual. And we would ask about the diet, and I hated to keep bugging them about their diets and whether they're taking their formula and eating good foods. But as a mom, I was worried about their health, and I just couldn't help it. Even though I recognized that they were adults and they would need to take ownership of managing their PKU diet to be successful in adulthood, I would always be worried. Now they're both adults and have graduated from college, have successful careers in their fields. One would think I could relax about them having PKU, and I don't. I still worry whether they're taking their formula and pills. I worry about them getting their nutrition from the foods they eat. I worry as they get older, they'll have other health issues like the bone density issues, cardiovascular issues related to this artificial diet. And although they are fortunate to have a treatment, I do hope for better options that allow more natural protein for them. And for everyone, I hope for more treatment options. As we have heard and as we're going to hear, everyone's different. And so one treatment is not a one size fits all. Everybody, I'm hoping we have different options for everyone. So that's my hope.
Thank you, Rhonda. Thank you for taking us on that journey through the years and how things shifted and changed. And I believe we have a caller ready to join us, and we'd love to invite Kelly from California to share her experience with her daughter who's now in kindergarten and how things have changed in your family as a result of just the differences in PKU. Kelly, are you with us?
Yes, I am. Can you hear me?
Yes, we can. Thanks for joining.
Okay. Yes, thank you so much for the opportunity to share. So I'm calling in to share in regards to the question about how PKU affects just what it makes harder to do in just normal life. And so this year has been a big year of transition for us. I have a 6-year-old daughter who started kindergarten this year, and it's been very interesting trying to navigate managing her diet along with building social relationships, which is such an important part of beginning the schooling years. So in her classroom, they have weekly just about birthday celebrations. So each of the kids, when it's their birthday week, they get to celebrate by bringing a treat on Fridays. And so just about every week, I'm coordinating with the parents of her peers to try to understand what they're going to bring and ask if they can send me the nutrition information or a photo of the nutrition label. And if it's something that's not suitable for my daughter, then I can send an alternative. And it's just a significant burden just for being able to manage. You know, I'm a working parent. We have a new baby as well. So it's just another challenge on top of everything we have going on to be able to manage that. But I don't want her to miss out on getting to enjoy those times with her classmates. And another example would be her friends invited her, for example, to go to dinner one day before going over to somebody's house for a movie. And they told me what restaurant they were going to, but I looked at the menu, and unfortunately there was nothing that would be suitable for her, and I just didn't have the time to be able to prepare something to send with her to eat. It was kind of an impromptu, like, tonight we're going to go sort of situation. And so she didn't get to go. I unfortunately had to tell her, like, we'll just eat dinner at home, and then you can go over to your friend's house afterwards. So, I mean, it's just a small thing, but I do feel that adding up over time, you know, she's going to unfortunately miss out on some experiences that her classmates get to have, the chances to bond, you know, with her friends. And so that's something that I wanted to share.
Thank you so much, Kelly. And I could see Melissa feeling similarly about those last-minute invitations and wanting so much for them to work out, and the disappointment and, you know, sense of loss about not being able to say yes for your child to have that experience. I think we have, do you have some comments coming through online?
Yeah, we do. Let's see. We have an anonymous viewer who says cooking low-protein foods isn't easy. When it comes to baking with starch flour and Metamucil, the food usually comes out dry. We have another one that has talked about there's sometimes gaps in the food supply of reliable low-protein foods. This impacts my executive function skills, which means staying on top of finding alternatives is challenging. I think that is it for now.
Okay, great. Les and Diane, any thoughts you want to add about just how PKU has changed for you over time, and maybe just reflecting on your long journeys with it?
I think, considering I've 46 years old, seen a lot of changes within the PKU options. When I was little, my parents got the first list they got with all the protein levels of foods was 2 typewritten pages. Now there are multiple apps out there that can track protein and P values. You can look up foods, you can take pictures of barcodes, things like that. So the amount of information that is available, the support groups, in the various states and in PKUA and even worldwide, one of the good things about the internet and social media is we can connect with each other, where there are so many people when I go to conferences that say, I never met anyone who had PKU until I was 18 years old or until I was 30 years old. we have a much better support system. The amount of choices, yes, they're limited, they're not ideal, but at least there are choices in formulas and in medical foods. They're not ideal, but it's better than when I was 6 years old. It was one choice of formula. You drank it or you went hungry. So things have improved. It's not ideal. It's not a natural diet. It's difficult to follow with a lot of hassles and preparation and planning required. But things have improved a lot in the last 30 years of PKU treatment. So I hope things continue to improve like that.
That's great. Thank you for pointing out the positives as well as some of the challenges that come with this. I see that we have Kirsten ready to join us by phone. And Kirsten, I think, wants to echo a couple points we've heard about those last-minute challenges that arise when plans change or things don't go as planned, in Melissa's words. Kirsten, are you here with us from Illinois?
I am.
Welcome. Welcome to the program.
Thank you.
And did you have a comment about just the impacts on daily life that you wanted to share with us?
Yeah, I think just to echo some of what everyone else on the panel has stated, I think, a bad day, it's that really on a daily basis, I have to deny my son just the basic necessity of life, which is food. And it's really hard when they come home from school and they want their favorite granola bar, and I have to tell them no, and they, why, and they get upset because I literally have to tell them they can't eat a granola bar because it's just 1 or 2 extra grams that I can't allow for them in their day, whether they've had, depending on where they are for the day and they still haven't eaten dinner. It's just something as simple as denying them food. And so I think that, and another thing I just wanted to kind of echo with some of the other statements was that even though they may be within treatment range, I still think that there are symptoms that are present, even though they, are within that 2 to 6 kind of Phe level. They still have more Phe in their bloodstream than somebody without PKU. And I think that definitely affects their moods or their hyperactivity and some of the other executive functioning that people have mentioned.
Thank you for pointing that out, Kirsten. That's such an important thing to keep in mind as we hear from even the people who've been able to be very well managed throughout their life, that you're still functioning at a different level of those toxins in your brain. And Melissa, I could see the emotion come across your face as Kirsten described the situation, having to deny her child food that he wants. I think
The last couple nights is my daughter has been procrastinating and stalling her bedtime, and she keeps saying, I'm hungry, I'm hungry, I'm hungry. And you've ate everything, buddy. You can't. So it's just very timely and relevant as the past few nights of a typical 2-year-old, right? Not wanting to go to bed, but we're limited on what we can do because, well, it's 8 p.m. She's already gotten to 250 milligrams. So it was especially timely. And yeah, I can feel for that.
Yeah, definitely. Well, thank you, Kirsten, for joining us. And we're going to move to our final segment before we take a short break and pick up on something that, Rhonda, you mentioned, a set of worries about, your sons and whether they've received adequate nutrition from the foods they're able to eat and what the future complications might be ahead for them because of the artificial diet they're limited to. And at this point, I'd like to invite Diane Obert to introduce herself and her journey briefly, and then address this question about what worries you most about living with PKU. And before we bring Diane into the conversation formally, her presence here today is rooted to the fact that at 23 months old, Diane was Exhibit A at a weekly pediatric conference at San Diego's Children's Hospital. She was the first child born in San Diego County to be detected as having PKU in the first few days of life by newborn screening. And if you can read it here below the photo in that newspaper story reporting on that event is the caption, "Diane Obert, saved from mental retardation by medicine, shows that she can work a jigsaw puzzle." So good for Diane working that jigsaw puzzle. And we kind of paired that vintage clipping with this photo of Diane on the day she received her master's degree, which is another achievement for which she may have been among the first in the PKU community to achieve. And Diane, as she said, also has an adopted son, Noah, who is 10 and has PKU. So thank you, Exhibit A, for being with us today, Diane, to share your experience and then answer the question about what worries you most about PKU.
Thank you very much. In October of 1965, almost three months before newborn screening was mandatory, I was born. However, the hospital I was born at began screening for PKU earlier than required, and that act changed my life. My parents and I had no other families for support. All the other children with PKU were intellectually delayed, and their parents had other medical and social concerns. In my era, children with PKU were intellectually delayed, some severely. The PKU adults were in state hospitals. There was no community and few resources, as the PKU diet was brand new to everyone. My diet consisted mainly of fruits and vegetables and formula. There were no low-protein foods at all yet. When I was 5, they did a protein challenge to see how much phenylalanine my body could tolerate. There's a videotape of me during the challenge. Because of the high phenylalanine levels in my body, I was not able to walk a straight line. I wrote the alphabet backwards, and I was very emotional. I acted like a 5-year-old drunk. At age 8, I began struggling emotionally with being very different from my peers. My doctors thought I would be okay if I came off diet. Taking children off diet was common practice back then, so at age 8, I came off diet. However, during high school, I recognized that when I ate meat and cheese, I got a headache. Nothing could take the headache away, only time. My grades were A's to D's, and I was struggling with school. The clinic said the headaches were unrelated, and I wasn't assertive enough at the time to challenge what was being said. I wanted to go back on my PKU diet, but I was in the minority, and my clinic didn't know what to do with me. At age 21, I finally got to go back on my diet. The state of California put on a maternal PKU camp. All 8 of us who attended camp were off diet, and we all had blonde hair. This happens when you go off diet for a long period of time. We learned about the PKU diet and the consequences of having a baby when you're off diet. The baby would have heart problems, a small head, encephalitis, and other things. I stayed on diet since that first camp. This enabled me to complete my master's with a 4.0. I haven't married, and I wanted to be a parent. So at 39, I adopted my first child, Tasha. Then Isaac at 41, and Noah when I was 50 years old. Noah had been tested and found to have PKU early. The orphanage where he lived before joining our family did the best they could to take care of his diet. There are a lot more choices of foods and formulas for him than there was for me growing up. So that progress is really good. I try to share the lessons I learned from being off diet between ages 8 and 21 to help him learn to make good choices. Being on a PKU diet is a constant balancing act with food and formula that goes into our bodies. In my 59 years of life, I've learned that the color of my urine helps me monitor my Phe. Dark yellow urine means you've possibly eaten too much Phe. As I look ahead, I'm approaching Medicare age, and that makes me worry. that I won't be able to afford or get the PKU foods and formula that I need to live. My dream for Noah and myself and others with PKU is to have a pill or something similar just to make life a little bit easier. I love to travel, but it's harder with PKU. At age 10, my son just wants to be able to walk in a restaurant and be able to order off the menu. He wants to be like his friends. As far as aging, I have no idea what to expect as an older person with PKU. I had breast cancer in 2020. It was caught early and treated. My family history includes heart disease. I'm at the forefront of PKU patients working to coordinate multiple doctors. I'm glad to be here as one of the PKU pioneers and contribute to my experience and Noah's with this meeting. And thank you very much.
Thank you so much, Diane. We know just how important your presence is here with us today as one of the people just on the sort of leading edge of living into a longer life with PKU. Les, I know you had some concerns about aging with PKU that you're ready to share.
Yes, and I echo some of Diane's comments about being of some of the older generation with PKU. Nobody knows what happens as you get older with PKU. If you're at higher risk of things like dementia or Parkinson's or Alzheimer's, because of the changes in the brain that even with well-treated PKU are still there. So there's that uncertainty of, like Diane said, not knowing what's in store. But my biggest concern about living with PKU right now is the diet, which we've discussed is difficult to maintain and a constant challenge. But it's also a very artificial, very highly processed diet. Yes, we eat a lot of fruits and vegetables, which are good, but the formula is essentially an artificial mix of proteins and amino acids with a lot of sugars added in, so it tastes good. A lot of the low protein PKU foods are the same way. They're essentially take the protein out, you're left with carbohydrates and sugars. And that's good when you're a kid, running around on the playground, lots of energy, lots of calories being burned. But as an adult, I sit at a desk all day doing computer work. I don't need the extra calories. So that's a concern of what is this artificial, highly processed diet doing for me? Am I at a higher risk for diabetes? Or there's concerns about osteoporosis, various things because the nutrition may not be quite right in the PKU diet, and it's highly artificial. So that's a concern, and obviously something that needs to be studied and improved.
Absolutely, Les. And one could only imagine what managing a PKU diet with a diabetic diet might look like and how few choices you'd be left with at that point.
Yes, yes, very challenging.
Yeah, absolutely. Thanks for sharing all of that. Catherine, are there any comments before we wrap this session?
There is. So Karen in Pennsylvania probably is echoing a little bit of what Diane and Les are sharing, but as a more mature adult, the consequences of aging with the PKU diet are challenging in and of themselves. A heart-healthy diet is typically categorized as being high protein, high fiber, low carb. This is the opposite of the PKU diet out of the necessity to keep Phe levels low. Frankly, I do not see a viable path forward to aging healthily while continuing to manage my PKU with metabolic formula and low protein foods. And I think a lot of older adults like Karen have these same concerns.
Absolutely.
We also kind of a different age group, but Kelsey in Washington, she said, I quickly get overwhelmed when I think about the lifetime ahead of managing this condition, the battles my kids will face due to their PKU, the resilience I need to instill in them, the discipline they will need to develop if Diet for Life remains our best option. And then also going back to some of the things Melissa was touching on earlier, Thea in Oregon, she says, my 4-year-old son is very classical and is always hungry, eating only 4 grams of protein a day. I worry about him staying on diet as he grows and his appetite increases.
So many challenges already in this first segment. Thank you, Diane, Rhonda, Les, and Melissa for helping us have this community conversation about the symptoms of PKU and the impacts. And thank you for sharing your emotion and your authenticity with us in really addressing these tough questions that cause you to relive so many painful things from the past. We're so grateful to each of you for being candid in this first session and the tremendous participation through comments and calls. And I know we could easily go on, but let's pause here. We'll take a 10-minute self-care break and return at 5 minutes before the hour, which would be 12:55 on the East Coast of the US. And for the next session, we'll discuss the current management and treatment approaches for PKU. So thanks, everyone, and we will see you back here shortly. Thank you all. Good afternoon and welcome back to the TruePKU EL-PFDD meeting. We have another full session, so I'll get us started with the second topic dedicated to management and treatment approaches for PKU. As a reminder, any comments submitted in writing that we don't get to during the next session will be part of the record of the meeting and will be used to generate the voice of the patient report that will develop over the next several months. The comment form will remain live on the website until June 8th, so you can submit your comments at any point over the next month. And you can find the meeting program, agenda, and the discussion questions that we'll be talking with our live panel with at the same link below where the viewer is that you're looking at right now. We'll start this session off with a series of pre-recorded presentations by PKU community members and then move into a live discussion. And for this set, we'll begin with perspectives from caregivers of young children with PKU moving to adults to reflect the range of management approaches used over the lifespan. First, we'll hear from Anna Phillips, mom to 19-month-old Ada, Kelsey and Jarrett Bleasdale, who have 2 children with PKU, Theo, age 3, and his younger sister Hadley. Then Casey Connolly, age 32, is followed by Kathleen Gonzalez, who will share a brief statement about her recent treatment update as read by Elena Jarecki. And finally, a short video from Richard Farquhar, age 44. Anna, over to you.
My name is Anna Phillips. I live in Roanoke, Virginia, with my husband and my 2 kids, and my 19-month-old daughter named Ada has PKU. We learned about her PKU when she was about 3 days old. She was diagnosed via the newborn screening tool. When she was 3 days old, we had her regular pediatrician follow-up appointment. We got a clean bill of health. I was a second-time mom at this point. Nobody in our family has PKU or any genetic disorders, anything like that. Healthy pregnancy, healthy family. So this wasn't on our radar at all. We didn't do any extra genetic testing. But later that afternoon, I received a call from the chief pediatrician at our pediatric group letting us know that he had just gotten word that her newborn screening tool came back abnormal for PKU. Of course, we immediately freaked out, super upset. However, he was assuring us that there's a really high likelihood for false positives with these screening tools. But he just had to be safe and get us an appointment with a pediatric geneticist the very following day at the University of Virginia. It's about 2 hours down the road from us. And like I said, we got in within the very next day. Obviously, that evening, my family and I are on the internet Googling, trying to still hold on to that hope. You know, maybe it's a false positive, maybe it's a false positive, but you're starting to see that kind of scary stuff, what it means to live with a rare disease. And of course, the images you're conjuring up, people with untreated PKU, are really scary. So upon arrival to the Children's Hospital, I was further anxiety inducing because you're seeing a lot of really sick kids. We're really thankful that PKU is one of the most common rare diseases. And outwardly, our kids do look healthy and normal, and they are. But it's really hard to grapple with those feelings of seeing really, really terminally ill, sometimes children, at these appointments. So we were told that her phenylalanine levels are about 15 times higher what they should be. So this was definitely not a false positive. So that was kind of the solidifying the diagnosis, and thus began when she was 4 days old, treating her PKU. We currently only use diet and per medical formula. The gene variant that she has, it leans more towards classical PKU, and the data that's available suggests that she wouldn't be a great responder to the medication Kuvan. However, her care team is hopeful that she would be a good candidate for something like Palynziq or some of the new treatment modalities that are coming out. So we do remain hopeful for that. Like I said, that 4 days old is kind of when our journey began. It was tough. Again, this is my second child. I kind of felt like I knew what I was doing, and then this gets thrown into the mix. I was really passionate about breastfeeding, and that became increasingly difficult over the months because trying to meticulously measure out the breast milk with the natural protein and still having like her Phe levels and having people who understood and was reassured that each stage of life with a child with PKU is going to throw us different hurdles, but we can't overcome them. I'm really lucky that my mother is retired and keeps my daughter while I work. I work as a nurse. Um, and again, it's that added layer of comfortability because I don't have to explain PKU to her. She knows. And she knows my daughter's diet and her formula and what she can and can't have. But it is definitely anxiety inducing thinking about her getting older and going to preschool. I intend to send her to half day preschool next year. And, you think about impromptu class parties and the snacks and things that little kids like that love. And you don't want your child to be different or miss out on things. But again, the community here that I've grown to love and be a part of has assured me that, we'll get through it. But again, PKU being one of the more common rare diseases, I'm thankful for it, but that doesn't mean that there's not still lots of fears um, surrounding the future and what the future is going to look like for her. So we're just trucking along and taking it day by day.
Hi, we're Kelsey and Jared Bleasdale, and we live outside of Seattle with our two kids, Theo, who's 3, and Hadley, who's 17 months. Both of our children have PKU, and they are the first in our extended families with this condition. About a week after Theo was born, we learned about his PKU diagnosis at our 1-week appointment with his pediatrician. While our doctor didn't know a ton about PKU, she was able to let us know that he would need more labs and that after those labs were done, that a specialist would give us a call. During the appointment, she told us that Theo wouldn't be able to process protein and that he would need a special formula. We rushed to local grocery stores and we were not able to find anything. We had no guidance and we had no idea what lay ahead in terms of sourcing products that would be healthy and safe for Theo to consume.
And as science teachers, we instinctively turned to research, trying to learn everything we could about PKU. We used resources like the Flock app to understand what low-phe foods we could give to Theo alongside his formula. And as we were beginning to feel comfortable with feeding Theo and low-phe foods and tracking all of that, we learned that we were expecting Hadley, and we hoped that if Hadley also had PKU, that it would give our kids a built-in support system and allow us to maintain consistent feeding routines. When Hadley's newborn screening confirmed PKU, we felt prepared, and in many ways, the experience was redeeming. We were confident in our ability to manage the condition well and knew we didn't need to panic this time.
Today, we feel really fortunate that Theo and Hadley can eat most of the same foods, they drink the same formula, they go every month to get their lab draws together. Our daily routines revolve around really precise meal planning. Every morning, we pack their lunch boxes for daycare with carefully portioned and measured and weighed foods, and we label them by Phe content. Our clinic has helped us transition more of their diet to solid foods. And we've tried to turn identifying and weighing low-phe foods into a game so that our kids can learn what they can and can't eat. To track their intake, we've developed a system with daycare where they return any food that the kids don't eat in the lunchbox containers so that we can weigh it and determine a dinner plan based on how many milligrams of Phe they have left for the day. They do not always have the same amount of Phe left for the day, and that is a challenge sometimes. And while the system works, it's mentally exhausting, especially after a long day of teaching. Throughout the last couple of years, our tracking has looked different ways in each season of life. As our work demands and daycare attendance changes with the seasons, as our kids grow, and as the items and amounts of foods that they eat change, we continue to refine our systems.
And finding reliable store-bought foods has been another challenge that we've been facing. Labels aren't often accurate, as far as how much protein or marked as no protein, they can still have traces of phenylalanine, which can be dangerous unless we have the time or tools to double check what the fee content actually is. One of our biggest frustrations is when brands change their ingredients or their formulas without any clear labeling or notification. For example, veggie straws, which have been a staple in our house because it's fairly filling for our kids and it fits well within our kids' protein limits. However, recently we noticed that veggie straws looked a little different. When we looked closer at the package, we noticed that the ingredients on the veggie straws had changed without any other indication. And looking at the recipe, that changed as well. And this particular ingredient that it changed caused a reduction of the amount that our kids can have each day safely. And unfortunately, this isn't a new experience. It's happened with other foods too, simply changing cassava flour out for sorghum flour or adding pea protein just because. Um, these things dramatically change the amount that our kids can have in a day and even causing our kids not to have it anymore at all. And with so few convenient and affordable food options for PKU families, these unexpected changes are quite disruptive and it causes us to stock up on supplies of food that have the recipe that our kids can have instead of purchasing the new version with higher fee amounts.
One change that would make PKU management significantly easier is greater precision in food labeling. In many countries, protein content is listed to the decimal point. Since every fraction of a gram matters for PKU, this level of detail would be life-changing for families like ours. Meeting our kids' nutritional needs and keeping them feeling full as they grow is already a challenge. Accurate labeling would at least take the guesswork out of it. Right now, we feel confident in the system that we have built to keep Hadley and Theo's PKU safely managed, both at daycare and with family and close friends. But we know that we're just at the beginning. Because we've been able to maintain such good control over their diets, we believe in a diet for life approach, at least while our kids are young. We don't feel the need to pursue clinical trials or other therapies until they are old enough to weigh in on that decision. Still, we hope that as food science advances, that nutrition labeling will follow suit.
My name is Jill Pickard, and I'm the mother of Elliot, a 15-year-old with PKU. We live in Basking Ridge, New Jersey. My pregnancy with Elliot was complicated from about the 20-week mark. My due date came and went. We scheduled the C-section, and I delivered 9.5 pounds of pure joy in May of 2010. The NICU nurse on standby declared, "That's the healthiest baby I've ever seen," and stormed out of the OR. The doctor scanned every organ head to toe, and he was perfectly healthy. Yet, 24 hours after coming home from the hospital, we got the call from the newborn screening lab to let us know that Elliot tested positive for PKU. We were shocked, especially after just being discharged with a completely healthy newborn. Right away, we started Elliot on a PKU formula. When he was born, Kuva had only recently been approved, and our clinic was not comfortable using this medicine for children under 5, as they do today. Plus, the doctors at our clinic did not think Elliot would respond to Kuvan, given his diagnosis of classical PKU. In time, we found our rhythm in managing his diet and advocating for his needs in settings where food was a factor. We were fortunate to have a supportive kindergarten teacher who kept a watchful eye, notifying us of any behavioral changes that could indicate his feed levels were off. When Elliot started swimming competitively, it was disheartening to encounter teams, even at the YMCA, that were unwilling to accommodate his diet. We often attend swim banquets where we have to pay $50 for a plate of broccoli, and I continually encourage the coaches to be creative with their team building activities. But it's easier to just have a pizza party or a pasta party or bagels and donuts after practice, especially when it's just one kid who can't fully participate. This is a common theme with PKU. being the only one in every situation. Elliot is now at an age where he'd rather go hungry than draw any attention to how he is different from everyone else. After years of resisting a trial of Kuban, Elliot relented when he turned 12, and we were pleasantly surprised that he responded. We saw an initial improvement in his executive functioning, and his protein allowance more than doubled from 9 grams to between 18 to 20 grams per day. It has allowed us to incorporate more of the store-bought normal foods Elliot desires, like gluten-free pasta, flour tortillas, and even small amounts of cheese. This past year has been especially tough, with heightened struggles in keeping his levels, diet, and emotions balanced. In high school, he has a 504 accommodation plan, but with so many teachers and students, it's hard to maintain the same level of monitoring and communication we once relied on. When his levels are off, the first things to deteriorate are his executive functioning and emotional regulation, the very behaviors required to manage PKU. When we have to pull him out of school for appointments at LabCorp or with his clinic, he falls further behind in school, compounding the cycle. Advocating for him has become a constant, as he isn't always able to advocate for himself when his levels are high. Elliot has shared that he notices the impact of high levels, but only once we get his levels back down. He doesn't notice in the moment, which makes it harder to course correct. He's now 5'11" and active on multiple swim teams, and needs a significant calorie intake to fuel his athletic life. Yet his swim coaches don't know how to offer dietary guidance for someone with PKU, and his clinic doesn't quite know how to offer guidance to someone swimming at the level he does. His doctor tells us there is no one else in their clinic quite like him. It's hard to be an N of one in an already very small rare disease population. Managing the PKU diet is mentally exhausting. I noticed this most profoundly a few summers ago when he was at sleepaway camp. Even though I had done all the prep to send him off to camp, that first morning, when I did not have to wake up and make his formula, I felt the release of all I had been carrying over the years. Summer camp is a chance for Elliot to learn how to manage his diet and advocate for himself, away from my protection and influence, and we are grateful to have found a camp that is able to work around the challenges of the diet. Looking ahead, Elliot is determined to gain even more freedom with his diet. The initial effectiveness of Kuban seems to be waning, and so he's excited to try Palynziq as soon as he is able, hopeful that he'll be a responder. The potential to liberalize his diet would be the ability to eat what he needs to excel in swimming and academics, maintain emotional stability, and finally feel full. We're especially eager to start this treatment before college so he can find his optimal dose and be comfortable with self-injecting before leaving home. Ultimately, Elliot's biggest wish is to enjoy real food, succeed in swimming and in school, and feel like any other teenager. As he prepares for his next chapter of independence, we hope that drugs like Palynziq and others being tested in clinical trials will give him the autonomy and confidence to manage his PKU and to be his very best self.
Hi, everyone. My name's Casey Connolly, and I've been living with classical PKU for 32 years. When I tested positive in 1992, my parents' world was rocked. They weren't sure if I was going to make it through the day or the year with the limited information that was available at the time about PKU. Now, as a parent myself of two, I couldn't imagine if newborn screening wasn't an option to ensure my child had been diagnosed of any life-threatening diseases at birth. Though my parents were unprepared at first, they quickly grasped the importance of early intervention. As a baby, they weighed everything I ate. From ages 0 to 14 years old, I ate mostly pastas ordered from specialty medical food companies and fruits and french fries. I don't recall ever having a truly delicious meal, but I did like pasta and I liked fruit. On top of the medical foods, I had to take medical formula 2 to 3 times a day to supplement the nutrients that I was not receiving from my over-the-counter diet. This made managing puberty and my weight difficult as I went from elementary school to high school. In school, I felt different because I was teased every day about my diet and formula. Imagine every break for snack time, lunch, after school carpools at ages 10, 11, 12 years old, asking friends' parents for other food options or if they could stop somewhere else to make sure they could find something that I could eat. Physically, I looked normal, but mentally, emotionally, I was struggling on a regular basis. Not just for that meal, but the morning before school, anticipating lunch, anticipating going to a friend's house. Not excited about the after school events, but anxious at 10 years old because I had to approach the subject of what foods I can and cannot eat. It's not just about the anxiety of approaching the subject that still persists today into my 30s, but it's also the knowledge that if you can't find a substitute that works for my diet, your options are limited. They're don't eat or eat, but physiologically hurt yourself every bite that you take, which then wears into the guilt of the next choice, the next meal. You feel the same guilt that you felt on the previous one. Thankfully, sports helped me build confidence to cope. By middle school, I started loosening my diet because the medical foods were too awful to continue on, and the reasons listed previously were just too much to continue to manage. Quickly, my mom noticed the effects of my lax diet on my mental health and encouraged me to join a Kuvan clinical trial at USC. It was the first treatment that offered dietary flexibility, so I was excited to try. In college, I played baseball, which made road trips and eating out tough. We'd often stop at a steakhouse or a barbecue joint, which doesn't provide any options for my diet. It wasn't truly then, it wasn't trendy then to be a vegetarian, and my friends didn't understand my strict diet. So I strayed away from my diet and drank plenty of alcohol, causing an onslaught of symptoms I didn't immediately recognize. After college, when I started working, I knew I had to get serious. My parents and my wife were my biggest supporters. My wife helped me commit to a lifestyle that keeps me as healthy as possible, which a regular routine schedule is the only thing that makes this diet practical. I still take medical formula twice a day, 10 Kuvan pills every single day, and then 14 large neutral amino acid tablets every single meal. Yes, that adds up to 52 pills a day that I need to take to sustain a limited diet off medical foods. Some days I eat less than I should because eating right is such a hassle. I'd rather not eat anything than sacrifice my levels or the medical foods that I should eat. I supplement with formula and eat as many natural foods from the earth as my diet allows. I encourage everyone, please, next time you're at the store, look at the nutrition facts of an orange, of an avocado, pasta, steak. Everything that you see has at least 1 gram of protein per serving. I don't track everything I eat. That level of micromanaging would affect my quality of life. If I had a monitor at home to track my feed, I would definitely use that to establish a baseline of what I'm doing on a daily basis. I considered Palynziq, but decided against it due to the continuous injections and risk of anaphylactic shock and other side effects. This was just one fear trading for another that in my eyes did not increase my quality of life. Turning 30 was a turning point. With 2 children, I worry about my long-term health. How is my body doing digesting 52 pills a day? How is my body holding up if I miss any of those 52 pills? How is my body reacting to not eating foods from the earth majority of my life, but over the counter? Protein is essential for the body, and I fear that without enough natural protein sources, my body will continue to deteriorate as I get older. I worry about the lifelong impact relying on medication and synthetic foods. And today, when I enter the doctor's office, we as a medical community do not know the answers to these questions. The best thing we can do is find a cure or a better treatment so our bodies can live off foods that we are meant to eat. Thank you for letting me share my experience and hope for a better future for all.
I'm Elena Jarecki, and I am going to read Kathleen Gonzalez's statement about her most recent treatment experience.
My oldest son's developmental difficulties came to the attention of a pediatrician and PKU researcher, Dr. Richard Koch. When he came to assess my son, he also encouraged me to get back on the diet and into care. As a result, I mostly have been eating a low protein diet since 2004. I had a third bout of bedridden illness in my late 40s, early 50s, which lasted for about a year. I was eager for a treatment that would eliminate my vertigo, so I started Palynziq just over a year and a half ago. After my third injection, I experienced injection site reactions, severe itchiness, and flu-like symptoms. I figured out a cold shower would help with that. However, after 18 months of treatment, I had an intense anaphylactic reaction that led to 2 days in the hospital. I was angry that the treatment I had put so much hope into had failed me. I decided not to continue Palynziq, and based on this experience, I do not plan to try other treatments unless severe side effects are ruled out. Now I am focused on optimizing my diet, the form of treatment that is within my control. I have been keeping my feed intake to 6 milligrams. I am back on formula, but the taste, texture, and even sight of it is awful, which makes it hard to get down 4 times a day. The taste and texture of low protein medical foods isn't much better, and they have a lot of carbs. While I have been good about incorporating more vegetables into my diet, my favorites like artichokes are higher in Phe, so I have to use a scale to make sure I'm not overdoing it. One of the hardest parts of staying on this diet is knowing exactly how all the foods I can't have taste and resisting the temptation to eat them. I cook regular meals for my family, so I'm surrounded by things I love to eat but can't. Most of the time, all I can have from those meals is a baked potato. If I have a little wiggle room left in my fee allowance at the end of the day, I'll treat myself to a popsicle. It's small, but those little joys really help me keep going.
Hey everybody, I'm Richard Farquhar. I'm 44 years old. I live in the United Kingdom and I have phenylketonuria, or PKU for short. Today I'm sharing a video of how I had to essentially try to retrain my brain really to eat new foods after successfully, thank God, successfully going through a trial for Kuvan, or where I'm from, ciprofloxacin, which is the unbranded version of Kuvan. I hope it's helpful for you and I hope you gain something from the video. Thank you. I was 42 before I had my first egg. And the reason for that, because my body has an inability to process an amino acid called phenylalanine. It was only when I was introduced to this drug, it meant that my tolerance level from food increased for protein, which is great because I could try different foods out. Whoa, nearly. So when I actually had the tolerance level from this to be able to consume this, my brain had to go through a very unique shift. Not only for actually what the hell do I do with this in order to prepare it, but also for eating it as well. Even buying food was a ginormous psychological shift, and one that I'd never been through, or something that significant throughout my whole life. I'm sure for those who have responded to the drug as well as I have and have passed the trial, have gone through just as much of a psychological shift and learning when it comes to purchasing and approaching food as well. And the type of thought processes that was going through my mind at the time, especially in the early stages, was I don't know what to buy. What food can I buy? If I buy it, what can I put it with? What type of meals can I create? What protein content is in there? What type of nutrients are in there? The whole thing was overwhelming really, because it was, and it sounds silly, right? And it probably is, but I'd spent the majority of my life where 80% of foods, roughly, were just off the table. They weren't an option. Here I am all of a sudden with all these options in front of me that I just ignored because of health reasons for my whole life. And I was put into a position now, thankfully, and I'm extremely grateful for it, that I didn't have all the options, but I had much more options than I'd ever had before. And that was massively overwhelming. I remember walking into a store numerous times, actually, and just staring at the shelves for a while thinking, right, where do I actually start here? It was like learning food all over again. Actually, to be honest, though, if we think about it, I hadn't ever gone through that learning process ever. So it was like starting completely fresh. And that is, for someone with a condition like I've got, that's what a wonderful opportunity that is. But it's a huge task. The amount of learning that I was having to go through was ginormous. And I'm so grateful for that. And so the egg was the one that I decided that I kind of wanted to try. And it was weird, right? Because I'd avoided it for so long, my brain had literally made, I don't know if it was a defense mechanism or something, and it probably was, right? A defense mechanism of, this is a horrible product. you shouldn't have it really. It was like my brain was sabotaging itself in order to keep my body safe. I literally remember approaching my wife and saying, listen, I don't know what to do here. I've got this in my hand and I don't even know what to do, which sounds crazy, but it was true. I didn't even know how to crack it yet. She had to actually show me the first time. I didn't even know how to boil it, fry it, whatever. And it sounds so silly, but it's kind of that with my life, right? Literally pure avoidance, kind of mental approach that was needed to unlearn everything I'd had previously and start to consume new foods that I've never tried before, that I've avoided completely, and was really, really strict with it. Strong willpower, mass avoidance. But the psychological effect that that has on an individual while they're having to kind of unwrap that as a process, just so you can start trialing new foods. It probably sounds silly, yeah? And it might be, to be fair. Definitely something that was like a tight-knit box or padlocked all in my head, and I had to kind of release those chains over time. Um, and it's just a silly egg.
Thank you, Richard, and to all of our panelists. That was an enlightening set of testimonies that underscores the array of approaches that individuals are employing to preserve brain health, relieve symptoms, and optimize overall well-being in the face of PKU. We also heard about treatments that are working well for individuals and about downsides and challenges as well. Our purpose today is not to spotlight any treatment approach or medication in either a positive or negative way, but to better understand how well available therapies meet patients' needs and what unmet needs remain. We will talk in the next session about treatment aspirations. If you would like to contribute to the discussion, please submit written comments using the form below the player or by calling in on our phone line. That number is 1-703-844-3231. Again, that number is 1-703-844-3231. While we bring our panel in for the live discussion, I will note some important defining lines related to our treatment discussion. And this is also coming up, we understand, in some of the comments coming through online. EL-PFDD meetings focus on topics that FDA has responsibility for. For that reason, there are some topic areas that, while important to PKU and the community, we won't focus on today. To make the very most of this very unique opportunity, we will not be getting into detail on issues related to insurance coverage, pricing for various treatments, or pending legislation related to medical nutrition. These vital issues are very worthy of focus in other settings and through other advocacy efforts in which NPKUA and other PKU-related organizations are very active. So, as we begin the discussion about the community's experience with treatment approaches used to manage PKU, we have a panel of community experts here with us. And we'd like to start first with Jen Christensen, who's age 49. She lives in Lebanon, Oregon, and has an older brother with PKU as well. And Jen, we invite you to share how your PKU management regimen has changed over time in response to the changing guidelines over your life and doctors' recommendations, as well as your 2 pregnancies and other circumstances of life. So welcome, Jen, to the program.
Hi, thanks for having me. I appreciate it. As Kim mentioned, I have an older brother with PKU. He was born in 1973 and gone through a battery of tests immediately and then placed on the low protein diet and treatment. So 2 years later, when I was born, my parents were pros and had me immediately put on treatment as well. The guidelines at the time were that patients would stay on diet until about 6 years old and then would be able to discontinue diet. However, the clinic I was at was kind of had the forethought of, I don't know if that's a good thing. And so thankfully we were never taken off diet. We were diet for life from the beginning. So that was a fortunate thing. As a child and a girl with PKU, I was told that I could not have children due to the damage that high Phe levels would have on my babies. So I grew up thinking that. And then into my teens, mid-teens, there was a kind of change in that of, well, it is possible and you could, but it's not recommended. We don't recommend it. It needs to be very controlled, very monitored. It's really hard. And then I remember in my teens, like going to appointments and being grilled, like, are you sure you're not having sex? Because this baby could be very much harmed by high Phe levels. And it just created this like anxiety of like a future, a family that I wanted to have. So I moved along in my diet, stayed on diet all throughout my teens and into my young adulthood. About 18, I was had to go off insurance. I was on my parents' insurance, and this was before the Affordable Care Act. So I was unable to stay on their insurance with our family situation. And so I didn't have insurance for several years. I couldn't access my medical foods or formula, and I had to just try and keep low protein without those. Thankfully, my brother had insurance part of the time, and so I'd borrow from him now and then. But during that time, I was going to school, I was working full time, had a social life, and it became difficult. My executive functioning struggled. I had migraines, they increased a lot at that time. Anxiety, emotional fragility, even some eczema and skin issues. I was able to get insurance in my early 20s and get back to diet and medical foods. And it was actually then that I realized the effects I was having. I didn't realize them at the time. As was said before in the other session, it's slow and you don't realize it. You're just like, oh, life is stressful. But that's when I realized it was when I got back on diet. 2008, I was able to trial Kuvan, and I was a responder, and I was able to double my tolerance, which, as Richard mentioned, is quite challenging. And I remember meeting my dietitian and her giving me a book and is like, an egg is 7 grams of protein. I was like, oh, wow, okay. And so I enjoyed that because it allowed me to introduce a lot of whole foods and instead of the synthetic proteins and the medical foods. Fast forward to 2012, 4 years later, and I was married, and my husband and I were planning to start a family. So I went off of Kuvan and back to the diet and medical foods. At the time, there wasn't a lot of known cases of women staying on Kuvan during pregnancy, and so we just didn't want to risk it. It's considered a Class C drug, and we didn't know what would happen. So there I was going back on to this strict diet, requiring medical foods, and also during pregnancy, in order to keep my Phe levels down, I needed to keep calories up, and that required more and more formula, more and more foods. One of the things is it's hard to keep calories up while keeping protein down. So I ended up with a lot of foods that were high in sugar and things like that. And that just caused a lot of swelling in my body. It caused a lot of fatigue and joint pain and all kinds of things. I was actually tested for gestational diabetes and I'm just below the marker, but my baby was born at 10 pounds, 7 ounces. So then he was tested a lot after birth. And we just think a lot of that was due to that diet that I was on. The other issue in pregnancy that was mentioned before was also the like having to increase your protein. And I went way beyond the end of my pregnancy, I went way beyond where I had ever gone and having to eat high protein foods. And anyone that's been pregnant knows at the end of pregnancy, it's very challenging to eat, especially when your baby's 10 pounds. And so I was having to try all these new foods I had never had. I was eating bacon and eggs and hash browns for breakfast. Yeah, that was quite a challenge. The other challenges are just all the extra testing you have to have. You're considered high risk. Doing blood levels, as the gal in the first session mentioned, 2 to 3 times a week, waiting 4 to 5 days for them to come back to even know what your Phe levels are. It's scary. I got morning sickness during my second pregnancy and had to take prescription drugs because if I was vomiting, that would make my Phe levels go up. Those gave me huge migraines, and I had a 1.5-year-old running around, which was quite difficult. I made it through both my pregnancies with my levels intact the whole time. And, my boys are 10 and 8 now, and they're doing great. They're at grade level. They're involved in sports. They have lots of good friends. They're amazing. They do have my 10-year-old has ADHD, dyslexia, and anxiety. And my 8-year-old is actually a gifted learner, but has some anxiety, OCD as well. I would definitely do it again, in a heartbeat, but it was hard. It was hard physically on my body. It took forever to recover. I still feel like there's effects. And financially, it was draining. We went into $40,000 debt for the medical foods alone in my second pregnancy. And emotionally and mentally, it was very stressful. I remember thinking I would have this pregnancy like my peers, where I was happy and joyful, and it was so great. And I just remember feeling anxiety and just sort of a cloud of like, I have to manage all these things and I don't get to enjoy this. Throughout my pregnancy. I'm back on Kuvan now and able to just eat a lot more whole foods and less medical foods, and it's been really great to be back in that treatment. However, it's still a challenge. Every day I have to think about what I eat.
Well, thank you, Jen. There's so much wrapped up in what you've just shared in terms of the different stages of life and how things evolved with different circumstances that you experienced. Thanks for walking us through that whole journey that you've been on. And if we've learned anything in this experience of planning for this meeting, we know that no two PKU journeys are alike. And we'd like to hear, Kayla, your experience. You have a 5-year-old son, Braxton, and you live in Casper, Wyoming. And please share how you're managing Braxton's PKU.
Sure. Thank you, Kim, for the introduction. Like Kim said, my name is Kayla. We live in Casper, Wyoming. My youngest son's name is Braxton. So he is our second child. He was born in 2020 and diagnosed with PKU on newborn screening. Although we had been through this experience before in the newborn phase, the diagnosis caught us completely off guard. When the call came, they didn't have, much information to give us except to let us know this was probably a false positive and not to Google it. But it was 2020, and the very common theme for people now these days is to Google things. So naturally we did. It was not very helpful. However, we found an incredible community that, has been invaluable to us. In those early days, I was really desperate for answers and a sense of community, and that was really hard to find on social media and Google at first. Braxton arrived just as the pandemic was beginning to sweep across the country, and treatment felt really frantic in the beginning as the world adjusted to a virtual way of care. We were fortunate enough to get 2 in-person visits before our care went totally virtual for about 2 to 3 years. Not a fan of the virtual care. I much rather would be in person, especially, when you first get that diagnosis. We did start our journey breastfeeding and using metabolic formula. But I had to give up breastfeeding pretty early just for my own mental health. We were unable to manage his levels with a free breastfeeding. So we had to go to measured amounts, which meant I was pumping exclusively. And in doing that, as well as, learning about PKU and navigating, life in, a new pandemic was extremely overwhelming. So we transitioned away from breastfeeding. Braxton does have classic PKU and follows the simplified diet where some fruits and vegetables are free, as well as some other items. He's allowed 4 to 5 grams of protein a day on the simplified diet. Can be hard to kind of know their exact tolerance when they're on that diet. But from food alone, he only gets 80 milligrams of Phe, which is less than 2 grams, and the rest he gets in whole milk. He's a pretty picky eater, given any toddler, right? But given, he's got an even more restricted diet, it can be hard to find foods that he's even willing to eat. When Braxton was first born, we did do genetic testing, which did show that he has 2 classical genes, and we were told he would likely not respond to Kuvan. So we waited until he was 3 so that he could express himself a little more. That means we relied on dietary management and metabolic formula to maintain his levels, for proper growth and development in those first 3 years. When we turned 3, we started on, I'll just say generic Kuvan, because I say the name very differently than how a lot of people pronounce it. And I want to make sure I say it the right way. So I'm just going to say generic Kuvan. Our hope, of course, when we started generic Kuvan when he turned 3 was to increase his protein, but that did not happen. But we did notice some cognitive improvements and some improvements in his cognitive function. However, we did elect to take him off of the medication last summer since we didn't see the typical response, and kind of to measure whether or not we felt like we really did see that cognitive improvement. However, every year when school begins, my son is only 5, but this is his 2nd year of preschool. So for last year's preschool and this year's preschool, as soon as school begins, his levels go up and they're harder to manage for us. And we know when levels are up, they can experience brain fog, emotional ups and downs, and trouble focusing, which were all things, we were seeing in him, making it harder for him to concentrate in school and get the best out of his experience. So when we resumed treatment, those symptoms improved. It's not a miracle fix. He does not get more protein out of it, but even small gains make a big difference, especially now that he's school aged. I want him to experience learning with as much clarity as possible without brain fog and emotional instability, I'm sorry. Generic Kuvan has also helped stabilize Braxton's levels, which has always been a challenge for us. So it's a significant relief, just knowing that we have that to lean on a little bit and can ease that roller coaster that it feels like we are always riding with his levels. Now that Braxton's older, his appetite is growing, but his tolerance isn't. With every diet change, it definitely feels like we have to relearn how much and what he can eat. Kind of echoing what Richard said in his video, you have to relearn the diet all over again. And when your protein tolerance increases, it's an immense amount of pressure. Each new stage feels like a moving target. And the mental energy it takes to stay creative and plan meals that will fill him up, that he will actually eat, is very exhausting.
Thank you, Kayla. What you and Jen have shared and what we've heard from others today is just how dynamic this process is. It's certainly not, even a series of plateaus. Your use of the term roller coaster seems like it is very fitting no matter what stage you're in. And your comments about breastfeeding Braxton relate back to some of the things Melissa shared in the earlier panel about that heartbreak of not being able to feed your son the way you had intended and planned. So we recognize that's a challenge for the moms too when they're faced with that decision. We have a caller ready to join our conversation. And Saeed, you'll be interested to know your mother is on the line. She's already, she still hasn't given up her following of you. We have Gloria from Arizona. Gloria, are you ready to join us? And you get the first word in before your son even has a chance to share with us.
Yes, I am ready to join.
Welcome, welcome. Tell us about, you indicated that he had difficulty managing on his own in early adulthood. So just tell us a little bit more maybe about the early days.
He was only 10 days old when he was diagnosed with PKU. And I had the same experience as this lady that just finished speaking. I had to stop breastfeeding also, which was very disappointing to me because, of course, I wanted to do that. But I knew I had to give it up, and I did. And we were very lucky because he was caught at a very early age. And we were in a situation where we had help, first of all, from Los Angeles at the Children's Hospital there. And then when we moved to Minnesota, there was an excellent PKU group at the University of Minnesota. So through his youth years, all went well. It was after I lost control of him that he got careless. And now he's 56 years old, and I'm happy he is finally back being very serious about watching his diet. And I appreciate this National PKU Alliance because I believe he is going to elongate his living years as well as his mental well-being years because of it. And I really just called because I wanted to thank that National PKU Alliance.
Thank you so much, Gloria, for sharing that with us. We know you were in the early cohort of moms learning this news about PKU through newborn screening, and we're awfully glad that Saeed was among those kids identified right away and had the chance to benefit from the early intervention. So it feels like
absolutely.
Yeah, well, great. Thank you so much for being with us, and Catherine's appreciative of,
thank you.
of your comments about the MPKUA. Saeed, now's a good time for you to step in and continue the story, thinking about the benefits and the drawbacks of the treatment you've received, knowing you've had a recent sort of game-changing experience. Please, Saeed Purcell from Texas is with us right now.
Thank you so much for welcoming me to this cohort here. And I cannot begin to express my gratitude for this program. I've been listening since the beginning. And as I told my mother when I told her about this this morning, it has been life-changing for me just being in this conversation, hearing the experiences. I literally was in tears in the first session. So jumping in, I was diagnosed with PKU just 10 days after birth, as my mother had just mentioned, which was a very rare occurrence for my generation in 1969 Florida. My parents had gotten divorced when I was 2, but my mother had persevered as a single parent and was committed to getting me the care I needed. Even under the care of Dr. Robert Fish, a leading PKU researcher, the belief at the time was that brain development was complete by age 7 or 8. My mother kept me on a strict diet until that age, and then my diet became more typical, although my mother made sure I was monitored. In high school, I started eating more of a vegetarian diet, and around the same time, I encountered some significant mental health struggles. Unfortunately, my mother attributed my mental health issues to the vegetarian diet and discouraged it. Going forward, I adopted a standard American diet. In college, I began facing issues with emotional control, maintaining focus, and managing relationships. These problems and my dietary habits followed me into adulthood, as my mother alluded to. When I met my wife, Hannah, at age 47, she brought a new focus on the moments of emotional instability and work difficulties that she felt were uncharacteristic of me. When I was 51, she encouraged me to get checked out by a primary care doctor, and that visit revealed I was on the verge of kidney disease. Almost 40 years, PKU was back as a focus of my life. From there, I tried Sapropterin, Kuvan, but my levels didn't shift very much. I was not a responder. I was still eager to get my health on track and try other avenues for treatment that wouldn't require me to make huge alterations to my diet. Despite my fears of needles and concerns about the potential side effects we read about, anaphylaxis in particular, I decided to try Palynziq in 2021. With Hannah's support and guidance from BioMarin's patient support team, Palynziq has been truly transformative and significantly lowered my Phe levels and is giving me dietary freedom. I still stick to a vegetarian diet during Ramadan, our month of fasting in the Muslim community, but otherwise I enjoy a standard American diet. While I can still experience some cognitive and emotional disturbances on Palynziq, I can't imagine life without it. Reflecting on my journey, I wonder what lingering effects remain from years of being off diet and what is simply part of who I am. Regardless, my chosen name when I converted to Islam, Saeed, means blessed, and I am truly thankful for treatment that has helped me reclaim my health and dietary freedom.
We're so glad that you've had that experience, Saeed, and that with Hannah's help, you found your way back to care and to therapy that's really made such a meaningful improvement in your health and in your ability to enjoy foods without the guilt and the repercussions that otherwise come with it. Catherine, I wonder if there are any comments from folks participating online.
There are. So we've got Matt in Oklahoma. And he said, when I was born and through teenage years, the only option was a low-pro diet. Back then, there were very limited options on formula and low-pro food. I also tried Kuvan in my early 20s and did not respond. I was in the trial of Palynziq and have been on it ever since. And then we also heard there's another person down here, somebody in North Carolina, just for a different perspective. There is no medicine that works for me. I had anaphylaxis from Palynziq, and I am not a responder to Kuvan. And then the last one that I will share is from Paige, also in Texas, like Saeed. While I have found a treatment option that works for me, it's still not perfect. It's not available for all. I have developed injection fatigue, and alternative therapies would promote improved compliance, patient satisfaction with options for alternative treatments, and better quality of life.
Well, that's really important information, and again, sort of deepens our understanding of how different each person's journey is with the treatments that are available. So let's dig in a little bit more on this topic of downsides to current management and how they affect daily life, including difficulties taking prescribed medical foods and available treatments. And to get us started on this topic, we have Carly Vonderwell, age 26, ready to speak to this. Carly lives in Indiana, and like Jen, she too has an older brother with PKU. So Carly, I'll invite you to share a bit about your experience and some of the downsides to treatment that you've experienced.
Thank you so much. It's a pleasure to be here with you all. Growing up, my parents were incredibly regimented when it came to diet therapy, to the extent that it was just normal. It was just our life. And to the extent that I would also crave my formula every day. And so it was normal for us, for my brother and I. And then we entered school and we ate different. Which meant we were different, which meant we were weird. And that was a really isolating experience for, I think I can say confidently, for both of us. And so when Kuvan started accepting applications to the clinical trial, when I was in the 3rd grade, I was about 8 or 9 years old, we decided collectively as a family that it would be a really beneficial opportunity for my brother and I. And so we took part in that clinical trial, and largely it was beneficial. We both responded relatively well. And in fact, I responded better than my older brother did. However, it was not without its challenges. My dosage was 12 tablets every single morning, and they weren't coated. And so oftentimes they would get stuck in my throat. And we tried everything. We tried crushing the pills and putting it in pudding. We tried taking it in the morning, in the evening, swallowing them whole, just about everything that you could imagine. And it was a really, really, really challenging experience, particularly with me being so young, trying to manage this. And it would create this sort of cycle of decline, in the sense that I would have maybe my medication get stuck in my throat and I would get sick, which meant I didn't get my dosage of Kuvan for the day, which then meant my Phe levels increased. And then I would have those side effects, as well as I would feel guilty about not getting my medication in, which then made me really unmotivated to continue taking it, which just furthered this cycle of decline that was incredibly challenging, seemingly impossible to break. So growing up, I was also incredibly active, particularly in high school and college. I played a lot of sports and really wanted to focus on staying active, being healthy, and building muscle. And so when Palynziq was approved by the FDA, of course, my brother and I said, of course, the freedom that could allow us, absolutely, we wanted to take advantage of that. So we both started Palynziq at the same time. And ironically, in this treatment, my brother responded far better than I did. And my dosage on Palynziq is 3 injections every day at the same time, which is a lot and very challenging to manage. And I'm actually still working on the right regimen for how to take all of that. However, at the same time, I have experienced just about every side effect you could imagine, including hives, shooting pain up my spine. I've had debilitating joint pain to the extent that I have had on just about every occasion to take prednisone in order to treat it. In fact, there was an instance in college where I had debilitating joint pain in my hands and my wrists to the extent that I could not hold a pencil, and this was the day before a written final. And so it presented a lot of unique challenges in college, and I started Palynziq in college, which made it really challenging. My support system was 2 hours away. And so as a college student, I handled a lot of responsibility in keeping myself consistent and communicating and managing through these side effects. Now, fortunately, as a newly engaged woman, my fiance has been a support system and really helps me manage my injections, take my blood levels on a consistent basis. And what has really been a motivator is a light at the end of the tunnel, if you will, is seeing my brother's success on Palynziq. And that has helped keep me persistent through seemingly insurmountable side effects presented by my treatment with Palynziq. Additionally, I was incredibly fortunate enough in college to study abroad several times, and my current role, my current job requires me to travel to Asia quite frequently. And my goal really is to be able to travel and eat with fewer concerns about potentially consuming something with higher protein than I think it has, simply because I can't read the menu. I'd love to have a treatment that is easier to manage and with fewer injections and is also a lot more functional to travel with. I'm also thinking ahead to starting a family and would love a better understanding of the effect of PKU, its treatment, and pregnancy, and what that holistically has, that impact has on my body as well as my babies during both the term of pregnancy and breastfeeding.
Thank you so much, Carly. So interesting that even you and your brother have had different responses to both treatments that you've both been on. So even within the same family, it can look quite different in terms of the benefit, side effect trade-offs that each of you had to deal with in that. And I saw Saeed nodding about when you were talking about your fiance doing the injections, and I know Hannah helps you with your injections, Saeed. So it's a family affair, this PKU.
100%.
Yeah.
My wife has been crucial in getting my regimen under control with rotating the injections. And I was up to 2 injections myself and have recently moved back down to 1 a day. I can't even begin to imagine navigating 3 a day and finding space on your body to do that. It's insane. It's truly insane. But the support of your fiance, family, it really is a game changer. I mean, the fact that my mother joined is an example of that. I've been very blessed again with the support I've had in spite of my 40 years off diet and formula and everything else, that I'm capable of doing this and being here today and being remotely functional, as my wife would probably say, is truly a testament to the grace that has been shown me.
Catherine, do we have comments from folks online?
Yeah, so we've heard from Sydney in Kentucky. And Sydney says, before the Palynziq study, my Phe levels were out of control. I was on diet and would drink formula when I felt I needed it, but I did not manage my PKU diet well or keep a strict eye on it. When I entered the study, my Phe level was 25. Within the first 6 months of being on the drug, my level went to 15 and then lower. We have been able to manage the levels to be around 1 to 2 since. It changed my entire life, regimen, everything, and for the better. We also heard from Samantha in Washington. And Samantha says, naturally, I can have 5 grams of protein per day. On Kuvan, I was at 10 grams a day. And now on Palynziq, I'm at 60 grams a day. And I'm not on any formula. So I think, different people have different success. But when we were talking, I think it was Carly was talking about her and her brother, and Jen, you too. Rhonda was kind of talking about that same thing earlier this morning, and that every journey is different.
Are there other downsides to some of the medical treatments that maybe you haven't heard yet that you want to make sure get into the conversation?
I'd like to jump in if I could real
Sure,
quick on
please, Saeed.
that. I've been, as the BioMarin team has said, a super responder to Palynziq. My levels have been below 2 consistently on a basically completely normal diet with full protein, like any quote unquote normal person. But one of the things I've noticed, although my serum levels appear to be under control, I still notice, and my wife echoes this, cognitive and emotional control effects. So one of my biggest concerns is that the serum levels, and I know this to be at least partially true, are not necessarily reflective of levels of Phe in the brain, which is where the damage is being caused. The current approaches to monitoring that are, to say the least, invasive excruciatingly so. But something should be done to try and find a way to navigate brain Phe levels, because those are the ones that are truly indicative of what's happening to the neurocognitive functions that are the most concerning for adults with PKU. And then someone else earlier had alluded to the idea of being able to monitor Phe levels consistently, not waiting a week to find out how you're doing. And then obviously it's too late to make changes to what you've done, and you don't know what caused what and how to adapt the following week, the following month, whatever. The lag time is really a problem in effectively managing this. And I know there's things in the works, but we need to find ways of getting that stuff to market faster and more effectively.
Absolutely. It's almost like trying to drive using your rear view mirror, right? You can only see what's behind you when you get that Phe level back from 2 weeks ago. Thanks for those additional comments, and so important to think about ways of measuring Phe, not only in the blood, but other tissues of the body, importantly the brain. Any other treatment downsides from the medical treatments that any of our panelists want to stir into the conversation?
I don't really have another like side effects so much. I think a lot of them have been covered. However, just one thing is people ask me often, like, "Oh, you're not going to try Palynziq? Why not?" And I think for me, it's like listening to people like Carly talk about all these side effects and knowing I have 2 children that count on me every day. I can't have debilitating joint pain. I can't have anaphylaxis. Sorry. And I don't know if I would, but just even the option feels off the table because of my life. You know, like you said, in college, you were having this pain right before a test, and it's very similar for me. I live hours away from my clinic and in a rural town. I can't risk the side effects in the life that I have right now.
Yeah, absolutely. And it's such an individual calibration of the potential for benefits and the potential for risks. And, you know, that's one of the things that this conversation is really helping us wrap our heads around is what are those, you know, ends of the spectrum that you have to weigh against and find that right balance and calibration for yourself and your family and your current circumstances. We know that those conditions can sometimes change across an individual's life. You might make a different choice when your kids are grown and other treatments are available. So really helpful to hear, Jen, that is an issue for you. And we heard Casey say in his statement that he felt like that trade-off was just not one that he was personally willing to make, but certainly a game changer, as Saeed has called it. And Carly, you're so committed to it at this point, and your brother's done so well on it. So we know for some it really is tremendous.
Kim, I'll add, there was a comment from somebody in Pennsylvania, and they say, "We wish our 2 children were Kuvan responders, and we hope they will never be on Palynziq." And it is interesting, you know, what a personal decision that can be.
Absolutely, yeah. And we'll talk in our next session about what do we most want to see for the future and what would ideal treatments look like. And I think some of these themes will come back in that conversation as well. So I want to bring Amy into our conversation. We have talked about some of the medical treatments in kind of detail at this point, but managing the low protein diet and medical foods is also such a big part of this. And Amy, you have 2 teenage children. Claire is 18 and Seth is 15, both of whom have PKU. And we've heard from Rhonda and some other moms about just the challenge that you face kind of navigating all of this. Please share kind of your experience, especially related to the challenges of managing their diets and their journeys as they've gone into now almost adulthood for both of them.
Thank you. It's my pleasure to be here. I actually have 3 children, and when our first child was born, his newborn screening test came back with a positive result for another condition, not PKU, and it turned out to be a false positive. So when my second child, Claire, was born and her screening results were positive, we thought it was going to be the same as it was with our son. This time, though, we were instructed to go immediately to the Children's Hospital for additional testing. and to wait for a call from the state health department. Instantly, we knew that Claire's journey would be different from her brother's. And when her younger brother, Seth, was born 2 years later, we knew PKU was a possibility. So we arranged for expedited testing for PKU that confirmed his diagnosis before we got the results back from our newborn screening. We were better prepared and equipped for that news than we had been for Claire's diagnosis. But I have to say, even the second time around, it still hit very hard. We started both kids on PKU formula, and they followed a strict low-protein diet for their whole lives. Claire and Seth were enrolled in the post-market pediatric study of Kuvan that was conducted at the University of Utah when they were ages 2 and about 10 weeks old. Managing clinical trial participation for 2 very young children was challenging, to say the least. And I was able to work with the site to get some aspects of what they were requiring changed, because I don't think the people who wrote the protocol had ever actually worked with children that young and understood what the challenges were going to be. You've heard from others today about all the complications kids experience with a fee-restricted diet. And as a parent and the primary family caregiver, it is a huge burden to carry to make sure both of my children are getting adequate nutrition and staying within range for their fee tolerance. For 18 years, I've thought about every single bite of food Claire and Seth have eaten every single day, every single bite. The calculations, the planning, the extra steps for shopping, ordering formula and medical foods, tracking, they're constantly running through my brain. There's no time off. There's no period when I can relax. There's no vacation from this responsibility of doing everything I can, and in turn helping them each do everything they can to make sure that every fee level is within the range for their immediate and long-term health of both their brains and their bodies. Both of my kids are very interested in normalizing their diets and being able to eat more nutrient-rich foods, especially since they are both very physically active. And I do want to note that at this very moment, Seth is competing in the state championships in high school tennis. And I use the term normalizing intentionally. I feel the term liberalizing for the diet conveys a certain judgment with it, that you're not strong enough, or you simply don't have the willpower to stay on a restrictive diet. And it's not that at all. In pursuit of that goal, both kids were excited when the clinical coordinator at our clinic reached out about a clinical trial opportunity for a medication that might have offered that benefit to Claire and Seth to have a more normalized diet. You'll hear later from Claire about why neither of them met the study criteria in the next segment of the meeting. One last point I'll add now is a wish that there was some way to quantify the huge mental burden, the extra time, the attention, the planning that goes into maintaining the low-fee diet. Reducing that would be a meaningful outcome for PKU treatment to give to our kids and ourselves as caregivers more freedom and flexibility to apply that enormous expenditure of time and attention to other endeavors in life. Our kids miss out on enjoyment of food as a social experience, and we do too as a family. And that's unfortunately a really important way to connect with others. And missing out on that is a toll of another kind that I hope one day we can eliminate. Thank you.
Thank you so much, Amy. And I saw a lot of nodding of heads among your fellow panelists when you mentioned that mental burden of just carrying all of the weight of every bite of food and knowing that you've got to keep that in the spreadsheet in your head, if not in some other format, you know, for every hour, every minute of every day, for every meal for Seth and Claire. And certainly harkens back to what we heard from the Bleasdales and Rhonda and Melissa in earlier sessions. So thanks for putting that prominently in the center of our conversation. I see we have a caller ready to join. Andrew from Colorado is an adult with PKU. Andrew, are you ready to share your perspective with us?
I am.
Welcome.
I hope you all, thank you. I just wanted to say that I'm lucky enough to have responded very well with Palynziq. My most recent level was 0.2, thankfully. But my struggle and management started when I was initially diagnosed with cancer, and hospitals do fantastically for taking care of yourself, but managing a diet where the hospital's like, we have normal diets, was something that was a bit of a struggle for mostly my parents. I was still trying to understand the diet at my age then. But as a result of my cancer, I also have diabetes, and so Palynziq has allowed me to work on my diet and manage that very succinctly, very well. I also tried Kuvan, but I did not respond to it, so I'm grateful for the Palynziq being able to allow me that management.
Well, thank you so much for sharing that, and certainly introduces a new variable that you've got to account for when something like cancer also enters the picture and affects what you can eat and your body's equilibrium. So it's amazing that Palynziq has enabled you to navigate that successfully. Thank you for sharing that, Andrew. Kayla, on this topic of managing the medical foods, I want to come back to you because living in Casper, Wyoming, you have an even greater challenge than maybe your fellow community members who are living in more urban or suburban areas with a few more options for local shopping. So tell us what that's like. How do you make that work in the area that you live in with less opportunity for the big stores?
Yeah, thanks for giving me the opportunity to talk about this. Excuse me. We do live in a rural state of Wyoming, which makes it very difficult to manage our son's PKU. We live in the second largest town or the second largest city, we'll call it, in Wyoming, of 58,000 people. So finding low protein foods that meet Braxton's needs and that he'll actually eat is a consistent challenge. Grocery store options are limited here. And when I say grocery store options, I mean chains of grocery stores. The very few more natural food stores that we do have carry a very narrow selection. Nothing like you would find in a very similar store in, say, Denver or Houston, even through the same chain. So we sometimes will request certain items, but a lot of times we're dismissed just due to low demand. And in addition to the dietary challenges, we travel 4.5 hours to Denver to Children's Hospital, Colorado, every 6 months for our clinic visits. They do supply us with the materials to do blood draws at home, but we still have to mail those to Denver for processing, and they do take 4 to 5 days to get results. So much like you said, Kim, it's like you're looking in the rearview mirror all the time, like what happened that caused that, and how do we manage it now, or do we not? Metabolic formula plays a vital role in managing PKU as well, but many of the available options are difficult for children to tolerate, and the formulas are often unpleasant in taste and smell and can even upset their stomachs. We went through quite a gamut with Braxton in finding a formula that didn't upset his stomach actually and cause severe diarrhea when he was a year, 2 years old. A large part of my day is spent reminding Braxton to drink his formula and worrying about whether or not he did or will finish it, which is a whole nother battle in itself. And on days when he's sick, it's harder to get down. I mean, there are some days he doesn't get it all down, and that worry in your brain of what that feels like is a lot. The specialized medical foods designed for PKU are another hurdle. Of course, we have access to those here where we live, which is helpful, but many are complicated to prepare. The directions on the packaging don't always match, kind of what you're practicing and making that food. And some of them just don't taste good at all, but they're essential. Without these options, children like Braxton simply would not get the nutrition they need to thrive and grow. So we're very grateful for the treatment options that are available, but we need more options that can help more people. Kind of as you've heard here today already from a gamut of people, they responded to this or didn't respond to that, or in our situation, we don't respond in the typical way to Kuvan.
Right.
Because not everyone responds the same in this diet is extremely hard. Families like ours need more options that support increasing protein tolerances in a safe, manageable way. because honestly, the thought of Palynziq sounds very daunting and scary for my husband and I, although we know that's his decision to make. Just as importantly, we need tools that reduce the guesswork and provide timely, actionable insight, because real-time data is life-changing for PKU. It would bring us closer to more personalized supportive care while easing the constant pressure of managing such a complex condition every single day.
Really important. Thank you. And I think your concerns are shared by people who don't live in as a remote an area as you do, but it's just an added burden and complication of meeting Braxton's needs when you have fewer choices and fewer options to shop for locally. Just looking around, I see Jen, yeah, you want to jump in on?
Yeah, just to piggyback off that, I live in Oregon and I'm 30 minutes from a college town. I'm an hour and a half from Portland, so I'm not super rural, but even still, I have to plan my weekends around, okay, I need to go to another town and go to 3 different stores. And actually on Kuvan, it's made it more challenging because those medical foods that we order from a pharmacy, they're too low. So I have to find other things that are higher, but not too high. And to complicate that more, like the caller said, he has diabetes. I've developed food intolerances, so I can't have wheat or corn. I can't have dairy. There's a lot of things I can't have. It just makes it really complicated to manage that, like that fee level. And it, like Amy said, I wish that you could quantify the burden because it is tremendous. And I love that she manages it now. And someday her daughter will have to take that on. And I just hope that there's a better system for her to do that. There's better medications and she won't have to feel the burden that her mom's felt and that those of us have felt.
Oh, thank you.
And I wanted to add to Jen, both of my children started Kuvan very young and responded well to the drug, but it didn't give them a normal diet. And so while they have a higher tolerance than most, they still can't eat many foods. And to Jen's point, we find ourselves stuck in this middle ground where low protein foods are too low, and yet things like meat and legumes are still too high. And yet, I think there's been some pushback in the PKU community that we have it easy because we do respond to Kuvan. And I've tried to explain to people, it's not about easy or hard, it's about different. Our challenges are different than yours. It doesn't mean they're not harder, or it doesn't mean they're not easier. It just means that they're different challenges for us. We still have restrictions that we deal with every day. We still have to weigh and measure and count all the food every day, no matter how much you can tolerate in a day. And until you have a normalized diet, you still bear that burden regardless of what your feed tolerance is. And I think that's an important point to make, is that these treatments, while viewed as helpful and successful, until you've eliminated that entire burden and given people with PKU the freedom to just eat food, there's more work to do.
And as Dr. Harding mentioned earlier, he's my doctor, so it's really fun that I get to see him. As he mentioned earlier, our levels are still not within a normal range, ever. I mean, they're in treatment range, but they're not in a range of someone without PKU. And at 50, I'm wondering how a lifetime of that is going to affect me. Yeah.
Absolutely. We heard a lot about that from our previous panel on that just unknown of the later years and how the impacts of all of these things sort of mount up over time. Catherine, do you have some comments from online?
I do. We have a lot of comments coming in. One in particular kind of goes to something Kayla was talking about earlier. Caleb, who is 16 years old in Arizona, he says, my PKU milk keeps changing. I get used to the taste, and the company keeps changing the recipe, which changes the flavor. When a person with PKU finds a formula we like, it's hard to find a new one. It's also hard to choose the right food to eat, especially when I'm with my friends. I'm too young to start Palynziq, and I'm scared of the side effects and giving myself shots every day. I hope that there is a pill available soon that does the same thing as Palynziq. We also have Blade in Massachusetts, and I think this speaks to something Amy was discussing earlier. The biggest challenge in life with PKU is the transition from parent-managed diet to patient-managed diet when the PKU child takes ownership of their own diet. And then I have one more comment I want to share, and it gives a little bit of a different perspective. This is from someone in Oregon, and she says, our daughter has a very low tolerance, is incredibly sensitive to Phe. Maintaining levels within range have been a big challenge her entire life. Even free foods will tip her out of range if she's had too much of them. For example, 2 to 3 oranges or a banana. Because of this, she struggles to consume enough calories and is on an additional caloric supplement. She was not a Kuvan responder, and her diet is very, very restrictive, making food options super redundant and challenging to ever eat out. So again, I know we've talked about it earlier, but just every single person's journey is so different.
Well, and the comment about the formula changing taste and consistency, the Bleasdales made a big plea for better labeling and let people know when you're adding out or changing, because you do become so, I mean, every little tiny, minute change is so important to people who are paying such close attention to every bite of food or drink of formula. It looks like we have Alexia from Florida ready to join the conversation. Alexia is an adult with PKU. Welcome, Alexia.
Hi, how are you?
We're well. Thank you for participating. What would you like to share with our panel?
So I've also had like a variety, like I've been listening to everybody's stories, and I also felt like, you know, I was also someone who was presented with more therapies, you know, Kuvan. I also did the clinical trial, which I responded fairly quickly, but as I was mentioning before, I basically still went off diet even when I was on Kuvan, so I needed more like more therapy options, you know. Just because I was at that point, you know, at that teenage years where I just wanted to eat everything and I was active in school and everything. So I basically tried Palynziq, and I'm only like one of 2 people who was in Palynziq at the time in the whole hospital, you know. So, and also it was important for me to be active in the community in PKU because I'm also just the only person in the family that has PKU. So now listening to everybody's stories, it really, you know, helps and, you know, motivates me as well to do better with my diet and with all of the challenges that I'm presented with PKU as well.
Well, thank you for that, Alexia. And, you know, something that you just said about being one of the only people in the hospital, you know, clinic on Palynziq, makes me wonder how equipped the care was, how the physicians in dealing with this newer kind of medication, knowing how different the response can be and the dosing can be, and that's an added challenge to getting a medication to work as well as it might for you.
Yes, of course, yes. And I responded pretty quickly and pretty well. So I've just managed to stay there, and I don't really take any formula, so it really changed everything of, you know, my life, my food life, you know. I just take the injections, but I also am not on formula, so which has been great as well to not worry about that extra challenge.
That's wonderful. We're glad that you've had that benefit from the medication and a new way of, you know, looking at food and the ability to just live with a little more freedom and less burden, as we've heard is such a big element in treatment benefit. Thank you for joining us, Alexia. I'm thinking about you, Carly, and, you know, the lengths to which you've gone to make this treatment work for you, and just thinking about that journey you've been on, and, you know, how you're experiencing sort of hearing this group of people reflect on you know, the challenges and the opportunities. That strikes anything, given sort of the rocky road you've had these past couple of years and getting to a therapeutic level.
Yeah, thank you for your question and your comments. I think it really underscores, I mean, as we've said many times, specifically in this session and throughout today, everyone's journey with PKU is very different and also very valid. I can sit here and say, yes, for several years, I have taken 3 injections every morning. Well, I mean, as best I can. Sometimes you get injection fatigue and all of that, which then also creates a cycle of decline in itself. Your level increases because maybe you didn't take your injections one day and it becomes harder. And, you have those side effects with the guilt, and then you don't take them a second day and it just continues to get worse. I would be remiss. I think my brother texted me and wanted me to share that I take 3 injections every single day, 7 days a week. He takes 1 injection 6 days a week. And he is completely liberalized. He has no concern with his diet. He does not track his protein at all. And I think it really just underscores that while I am valid in my struggle and my, sort of fight to make Palynziq work for me as the best treatment for me right now, that he is also very valid in thinking I love Palynziq because, I only take 1 injection, not even every day of the week, and I basically don't have to think about PKU anymore. And then also to the individuals who say, I'm really afraid to start Palynziq. That is also incredibly, incredibly valid. And it's a decision that you make with your care team. And I think it just highlights that there's a need to create treatment that people don't have to be afraid of. And I think that is crucial. And I think that is just highlights that there's so much more work to be done. And something else that I thought of earlier was my personal struggle with PKU is and this is, we understand medical institutions are often understaffed, and that's completely understood. And this is not a remark on that. I submitted a blood Phe level 3.5 weeks ago, and I still don't have that blood Phe level back. And it's unmanageable. I have, while I can say I think I'm fine, you can look back and say, well, also symptoms and side effects of high Phe levels are slow. And we've heard many times today, I had no idea what I was experiencing until I was treated. And I could sit here and think that even now I'm an eloquent speaker and I'm doing a great job. And then I, fix my Phe level in 3 weeks and go back and think, oh man, I talked for way too long. And it's also a challenge with underlying unrelated maybe medical conditions people may have, but it often gets blamed on PKU. If you think of a high Phe level, if you think of the symptoms and the side effects of a high Phe level, now think of ADHD, now think of ADD, and just think of how that presents in a person. How are you supposed to understand it? Is my Phe level high? Or do I need to consult someone about an underlying condition that we don't know I have right now, when your Phe level it's taking weeks to come back sometimes? And it's like, can anyone here tell me exactly how they felt even 1 week ago today?
Right.
Life happens. You don't track that as much as, maybe we would like to.
Right.
And I think that's a crucial aspect, is that until we can get more immediate responses with our Phe levels, people are going to continue struggling with their Phe management, maybe because of an underlying condition that they should be treated for, but it gets blamed on PKU.
Absolutely. And we're going to talk more about monitoring in the next session. And before we close this one out, I just saw Saeed's hand go up. And maybe, Saeed, the last final word before we go to a break.
Yeah, thank you for that. I actually, similar comments to what Carly had just stated about the fears of that. It's real, and even though I'm a so-called super responder, I was terrified of starting the regimen. I couldn't say no because Kuvan didn't work and it was clear that there were problems. But I was having massive anxiety around the entire thing, the anaphylaxis. I mean, you have to go through a training to acknowledge the risks. You have to do all of these different things. I was having absolute terror over the entire thing, and I was not over that for at least the first few months. And terrified of needles long before the idea of Palynziq even came up. So it is, as Carly said, a very valid feeling. And you do have to make your own choice. I made that choice for various reasons, and I'm thankful that I did. But as great as help as it's been, it's not a perfect solution. And more work is being done. More work still needs to be done. Feed monitoring is a huge part of that. Being able to respond in near real time to what's happening is crucial. And I can't thank you guys enough once again for having this opportunity to share our stories and to get this response out to the stakeholders in this.
Absolutely. Well, thank you so much, all of you, for such moving experiences that you've so willingly and beautifully shared with us. The emotion was obvious as each of you spoke, and we really appreciate the heartfelt and authentic way that you shared your story. As I said, we have one more session yet to cover, and we're going to dive into these issues about monitoring and future treatments, treatment aspirations, and the clinical trial experience. But let's pause for a brief break. We'll return at 40 minutes past the hour for our final session. Thank you all, and thank you, everyone. We'll see you back shortly.
Sorry, I was just going to also add, we did have some callers that we weren't able to get to, and we just appreciate everyone calling in, and we will have one more session.
Thank you so much. Welcome back to the TruePKU externally led patient-focused drug development meeting. We're in the home stretch now with another vital set of topics to address: perspectives on future treatments and monitoring, treatment aspirations, and clinical trials. We'll begin this session with a series of pre-recorded presentations by PKU community members, followed by another live discussion. First, we'll hear from 35-year-old Bianca Albanese, then Meredith Baker, age 23, followed by Heidi Maxfield and her 17-year-old son, Owen, concluding with 17-year-old Claire Oliver. Bianca, take it away.
Hello, my name is Bianca Albanese. I'm a 35-year-old biomedical engineer and postdoctoral fellow living in Sydney, Australia. I'm extremely appreciative to be able to share with you the realities behind my PKU management. My personal journey has given me a unique perspectives on the limitations of existing therapies and what I believe must drive a curiosity for the long-standing and persistent symptoms I experience as an early treated and well-managed individual. I was diagnosed at birth and up until recently only treated with a medical supplement and a diet of just 6 grams of protein a day. With incredible dedication from my parents, my levels were mostly in range. Monthly Phe levels would be posted to the lab, with results received soon after. Today, this same process takes over a week and is becoming quite costly. While I'm so grateful for what dietary therapy and medical supplements have spared me, it is my hope that future treatments will address the challenges I've encountered throughout my PKU journey. I've experienced digestive issues related to formula and the medical low-protein foods that I rely on. I'm constantly hungry and I struggle with energy. I feel as though I operate with limited resources. I carefully select my activities, knowing I will tire faster. I plan, think, and manage my rigid medical routine. But naturally, when that perfection breaks, guilt follows. How is that affecting my brain? To me, fluctuating high or low Phe levels give me headaches, sore joints, and a feeling of overwhelm and sadness, like a black cloud is over me. And unfortunately, this is an unseen burden by many. Just because I carry it well doesn't mean it isn't heavy. From the outside, I may look like a successful adult. I have 2 degrees, a PhD, and a good career. But it is really only a select group of people who truly understand my day-to-day life with PKU. Many of my struggles feel minimized as my Phe levels are good, so there isn't an issue. I must admit I struggle at times. I feel like I'm a clown juggling. Some days I manage to keep all the balls moving: PKU, career, health, social life, energy, and my mental well-being. But it is never effortless. It's also fragile. It only takes a slight disruption, sickness, stress, hormones, or a natural lapse in willpower to send everything crashing down. And the consequences aren't subtle. When the one PKU ball drops, it creates a ripple effect. Energy plummets, cognitive function falters, my mood becomes low, and I have a feeling of absolute overwhelm. Everything feels impossible in that moment. Unlike the clown who can pick up the ball and carry on, for me, restoring balance takes time, effort, and sometimes the ability to just accept that some balls won't stay in the air at all. The constant juggling is exhausting. When I had the opportunity to trial Kuvan, I noticed improvements. My energy crashes have been less frequent, I'm happier and better able to handle challenges and better digestion. However, my Phe levels remain very similar to before, well controlled. How else is this drug helping me, and how can this be measured? I felt similar benefits while participating in a clinical trial. My Phe levels dropped significantly, and I was eventually able to reduce my medical supplement and eat up to 60 grams of protein, 10 times my natural tolerance. Coming from such a food-centered Italian family, it was really meaningful to enjoy the meals they love. For the first time, I felt truly satiated and free from the constant hunger that had often accompanied my low-protein diet. Unfortunately, as time went on, I began experiencing symptoms that ultimately led to my difficult decision to withdraw from the trial. I am now back on 6 grams of protein a day. A challenging aspect of clinical trials or adjusting to new medication are the symptoms from Phe fluctuations. I found fluctuations or holding prolonged high or low levels to be debilitating. Protocols would benefit from being reactive and receptive in these instances to account for the significant impact on patient well-being. There must be a paradigm shift in future treatments to prioritize and improve patient outcomes. I believe we need efforts geared towards developing methods to measure broader outcomes and pharmaceutical tools to ultimately provide a holistic solution that enhances overall well-being. Thank you.
Hello, I'm Meredith Baker. I'm 24 years old. I live in Dallas, Texas, and I have PKU. I was diagnosed with PKU through newborn screening at just 10 days old. Thanks to my parents, I have been lucky enough to have been educated and taught about living with PKU to maintain a healthy diet and Phe levels within the healthy range of under 6 milligrams per deciliter. I've been on formula and a low protein diet my whole life. With having Phenex 2 and Glytactin throughout my regimen, I'm definitely able to maintain having a healthy Phe level. I'm lucky enough as well to have attended conferences through the National PKU Alliance and different camps such as the Flock Camp and other affiliated camps through the National PKU Alliance while growing up. I've definitely learned while attending PKU events, camps, and conferences that the community is shaped by having the strength together and being able to manage and reflect on each other's experiences. Through having with having PKU throughout school, I have had accommodations such as allowing to have my formula with me throughout the day at my desk and eating low protein foods from the school lunch line. I'm thankful for multiple treatment options that are available in the PKU community, but there are definitely things that we still need, such as more treatments and more ways to manage our PKU. For example, Kuvan was not a medication that worked for me, but it works for many. And I hope that someday there's going to be more options for more people in the community that are able to try. Well managed PKU still comes with challenges. For example, whenever I am managing my PKU and I do have a headache, I can tend to think, is this PKU related or not? When this happens, I do tend to take my Phe levels by finger prick. I tend to prick my finger and fill 5 circles on a piece of filter paper that gets mailed to the state. I end up having to wait about 2 weeks to even get my results. With that being said, I have to track my food and my how I feel through the Flock app or through the good old fashioned paper and pen route, keeping notes directly on how I'm feeling and what I'm intaking, formula wise and food wise. This can take 2 weeks, as I said, to get the results. And this shows the difference that can be made if we had an at home Phe monitor. If we had an at home Phe monitor, we would be able to have instant results with being able to change our our regimen and how we're treating our PKU in the moment rather than having to wait 2 weeks and reflect back on what has happened between that time. Monitoring Phe levels have become one of the most rewarding parts of my journey. On Fridays, my friends and I co-host Phe Level Friday, which has become a hashtag used throughout social media, encouraging the community to check their Phe levels and stay on track of their diet and or any type of treatment that they're on. With being on different treatments, whether that's a different medication, formula, or diet regimen, we all need to be able to track our Phe levels and maintain the goal of having our levels between lower than 6 milligrams per deciliter. Each test costs me about $8. By the time I receive my results, I do have to look back at my notes and figure out what might have caused spikes if there happened to be a spike in my level. Phe Level Friday shows the power in the community and the support and connection that we all have with living with PKU. I do think with faster results through an at home Phe monitor, we can make informed choices right away instead of relying on data that could be up to 2 weeks old. The impact that would be changing our lives with having more results immediately would be incredible for so many of us. I do understand that PKU is a unique journey and we all have different experiences. But having quicker access and more reliable information about our Phe levels would empower me and many others in the PKU community to control our PKU and to have our health and well being prioritized. Thank you.
Hi, I'm Heidi Maxfield.
I'm Owen Maxfield.
Owen is my 17-year-old son, and we wanted to share just a little bit about his PKU story. Owen was born in 2007, and we were living in Louisville, Kentucky at the time. When Owen was 9 days old, we got a phone call that Owen had tested positive for PKU. At that time, my husband was doing his medical training, and neither of us had heard of PKU. We didn't know anything about it. So we quickly flipped to a little tiny paragraph in his medical textbook that gave us very little information and just some alarming statistics. We had put Owen initially when we were living in Richmond, Virginia. We had put Owen on a clinical trial for Kuvan that had just been approved by the FDA the year that Owen was born. So when Owen was around the age of 6, the clinic in Richmond, Virginia wasn't really pushing Kuvan, but they told us we could try it. So we put Owen on a trial and he had a mild response, but because it was so expensive, we thought we didn't want to sign up for that, the lifetime of that. And we waited a little bit. In the meantime, we moved to Salt Lake City, and our clinic there was very excited about Kuvan and they encouraged it. So we ended up doing another trial when Owen was around 8 years old, and he ended up having a better response than he did the first time, which allowed him to go from 7 grams of protein a day to 18 grams of protein a day, which, almost tripling your protein allowance at that level was life-changing for us. It allowed Owen to have like one regular bag of chips at school or like one piece of white bread with his friends, and that allowance helped him to feel more normal socially, and it made a big difference for us. Skipping ahead several years, when Owen turned, I think it was right before he turned 17, there was a new clinical trial happening, and our clinic suggested that Owen might be a good candidate for it. In order to participate in the trial, you had to have several blood Phe levels that were higher than safe. And luckily, after digging through Owen's history, Owen had just enough high blood Phe levels from times he'd been sick over his life that he was allowed into the trial. So the trial was very rigorous. He had to weigh and measure all of his food. Anything else you want to say about the trial?
Had to just take blood tests like almost every day.
He had to take a lot of blood tests. And also during this, he, was just a regular high school student. So he's a student athlete. He's trying to keep up his grades, and he is weighing and measuring everything he's eating and doing frequent blood tests. The trial ended up showing some really positive things for Owen and helped him liberalize his diet, which was life-changing for Owen and for our whole family. Just not having to spend so much money, since Owen's a growing teenager, we were having to give him so much formula before just to help him keep full. His medical formula was like drinking 32 ounces, is that right? 32 ounces a day before this clinical trial started. And then when we started the clinical trial, he was slowly able to wean off of his formula. And probably last summer, he was able to try his first hamburger, which sounds silly, but was a really big deal for our family, for him to be able to go with friends. And it really was just like a remarkable thing that we didn't know would ever happen in his lifetime. So just giving him that new freedom and giving his parents that freedom really was life-altering for us. in that last, it's been a year, he's gained over 20 pounds and he feels better. He has more energy, and not having to track so much of his food really was just such a big deal for our family. It's opened up a lot of doors. Owen plans, why don't you tell him what your plans are in the next couple of years? You're going to be a senior in high school, and then what?
Probably go on a mission.
You want to serve a mission for our church, which is a 2-year commitment away from home, and
go to college.
He wants to go to college, and just having the freedom to do those things without the restrictions of food and formula being a big problem gives us a lot of hope that that the rest of his life will be a lot easier than we thought it was going to be. So that's our story.
My name is Claire Oliver. I'm 18 years old, and I live with my family in Salt Lake City. I was diagnosed with hyperphenylketonuria, or hyperphe, a milder form of PKU, after testing positive on newborn screening. My younger brother Seth also has PKU, but my older brother does not. As soon as I was diagnosed, my parents made sure I followed the strict PKU diet. Growing up, that was all I knew. I got used to eating before going out to restaurants and bringing my own food to birthday parties. That singled me out, but I also learned to be more independent and better able to speak for myself at a young age. I also felt some judgment within the PKU community because I had a hyperphe. It's true that I have a higher phe tolerance than people with classical PKU, but we all face the same challenges of having to think about every single bite of food every day forever. My life is nowhere near carefree. My mom enrolled my brother and me in the post-market pediatric study of Kuvan when I was 2 and he was about 10 weeks old. Being on that medication increased my phe tolerance and allowed me to expand my diet to include some new foods. My brother and I have always carefully followed this diet, which is even harder now that we're older and more active, since it can be really hard to get enough protein and nutrients to sustain our body's needs. Seth is a tennis player, and I can tell you, he's hungry all the time. Since birth, Seth and I have been managed by the Department of Medical Genetics at the University of Utah Hospital. In November of 2023, the clinical research coordinator contacted my mom about a clinical trial that she thought we'd be perfect for, because we carefully track our diets and stick to them. We were all excited about the possibility, even though from our experience in the Kuvan clinical trial, we knew it would require a lot more clinic visits, time out from school and other activities, more blood draws, and extra work at home to keep track of everything. So it was very upsetting to learn that neither Seth nor I had qualified for the trial, because neither of us had ever had a phe level of 600 micromoles per liter, which was a requirement to qualify. I was really angry that the chance to try a new treatment option was off the table for me and my brother, because we'd done too good of a job managing our diet. They told us if we could get our levels up to 600, we would qualify for the study, but doing harm to ourselves to get into this study was not a choice we were willing to make. But it did inspire me to do research on clinical trials, what is measured and why, and try to understand why the seemingly arbitrary blood phe level of 600 was so important. I summarized my research into a poster that I presented at the scientific conferences of the American College of Medical Genetics and Genomics, as well as the Society for Inherited Metabolic Disorders. In addition to providing background on PKU and the treatment burden that fellow PKU community members have described so well today, my poster highlighted 3 major flaws in the current clinical trial model for PKU. First, the standard inclusion and exclusion criteria penalize success by excluding the most compliant, dedicated, and successful PKU patients. Second, by limiting clinical trial participation to individuals who have had instances of poor control evidenced by their levels of 600, studies may enroll individuals who have a harder time following and completing study protocols, which puts trial validity and reliability at risk. The third is that 52% of the estimated 16,615 PKU patients in the U.S. are not receiving care for PKU, and therefore would be unlikely to know about or enroll in any clinical trials. And 38% of the PKU population is under 18, and also not eligible for most clinical trials. Ultimately, these criteria are exhausting the non-compliant patient population and incentivizing compliant patients to harm themselves to support research. This jeopardizes the future viability of clinical trials and may deprive our community of the opportunity for an improved quality of life. I'm hopeful we can move from looking at absolute Phe levels to percentage reduction of blood Phe levels and to measures that reflect diet normalization as meaningful indicators of change. Thank you for your attention and this opportunity to share my hope for a more inclusive, patient-centered clinical trials to advance new treatment options for PKU and improve lives.
Thank you, Claire, and to this group of speakers and all the people we've heard from today for helping us better understand what matters most to people of all ages living with PKU and how best to advance patient-centered research, treatment, and care. Before we invite our panel to join the conversation, I'll remind PKU community members that if you would like to contribute to this discussion, please submit your written comments using the form below the player or call us at 1-703-844-3231. Again, that number is 1-703-844-3231. Comments submitted in writing or by phone, including those we can't get to, become part of the meeting record, and we'll use them to generate the voice of the patient report that will be developed over the coming months. The comment form will also be live on the website until June 8th, and you can find the meeting program agenda and the discussion questions we'll use right there, right now. So this question, short of a cure, what specific things would you look for in an ideal treatment, is one that we really want to hear from the community about. So please use the comment form or call in to tell us how you would answer it. We know everybody's answer might be different. Bianca focused on increasing Phe tolerance, reducing reliance on medical supplements or formula, feeling satiated and enjoying foods her Italian family loves. She also emphasized having more energy and more freedom in her life due to fewer restrictions from her regimen, and called for treatments that improve overall well-being. Sarah Gallagher, who is mom to 15-year-old Maeve, joins us as a member of the final discussion panel for today to share what she and her daughter look for in new treatments and what would be a meaningful improvement. Sarah, Maeve, and their family live in San Antonio, Texas. Sarah, welcome to the meeting, and share with us how you see the most ideal treatment of the future.
Sure, and thank you. So yeah, our daughter Maeve was diagnosed with PKU at 5 days of age. And actually, like other parents have said today, my husband and I had hoped that at that initial screening was a false positive. We actually asked our pediatrician at the time about that possibility, and when she mentioned that she had never actually seen a false positive, and in fact, she had never even seen a screening come back positive for PKU at all. That's when we started to realize that maybe those results might be indicative of something real. However, we were still thrown into shock a few days later when that follow-up test confirmed her diagnosis. So in terms of treatment for Maeve, we of course started formula and a Phe-restricted diet immediately. Maeve has also been on sapropterin. She took that from age 8 until very recently, although that medication did not increase her protein tolerance. And then Maeve started Palynziq at the end of 2023. Our hope for her is that someday, hopefully soon, she'll be able to stop taking her formula altogether, that she'll be able to enjoy a fully normalized diet. That hasn't happened yet. We have gotten a small taste of that. Her protein tolerance is now up to 30 grams daily, up from 7 when she did before she started Palynziq. And just a small example of how that has changed her life. She recently went on a multi-day field trip, and it was the first time she could order food off menus along with her friends. She was eating mostly vegan meals with her friends, but that was huge because we didn't have to pre-pack special foods for her. It was the first time we didn't have to prepare and pre-pack her food other than her formula, which felt huge for all of us. However, that progress has not come without cost. Although the extra protein does feel really life-changing for our family and for Maeve, she's still balancing the consumption of formula, protein. She's still, doing all her calculations for protein and other nutritional components of her diet. She's balancing medications to address side effects and her injections all on a daily basis. And with Palynziq, she has experienced significant side effects. Actually sounds pretty similar to those that Carly shared earlier. Those have included joint pain so intense that she could not use her hands at times. And there have also been days that we had to carry her around the house because it was too painful to walk. She's experienced redness and swelling in an injection site, and she still gets hives from time to time. And she has to carry an EpiPen at all times. And like others mentioned, the uncertainty of the long-term impacts of frequent injections does weigh on us. She currently has to inject 11 times a week. And as I mentioned, it hasn't quite yet helped her reach a normalized diet. So that number of injections may need to increase in order for her to reach that goal. And although she has found the courage to start giving herself injections, a dream treatment would definitely be something that did not require her to do that, something that did not carry such a burden of the side effects and didn't require her to carry an EpiPen. And I think an ideal treatment wouldn't require her to take it every day because it's a lot to manage.
Thank you so much, Sarah, for sort of putting that in perspective of what Maeve has experienced with her treatment journey to age 15. We really appreciate how concrete you made that. Megan Rogers is also with us and has given thought to this question about what treatment advances would be meaningful. Megan is 36. She's a licensed school counselor, a doctoral student, and lives in Western Massachusetts, and also had experience with different management and treatment approaches, including as a participant in the open label arm of the clinical trial for Palynziq. So thanks, Megan, for being with us today and sharing your perspective.
Yes, thank you for having me. So in 1988, I was fortunate enough to be born in a state that mandated coverage for PKU foods and formula, and in an area of the state that had access to multiple PKU clinics, which is pretty atypical. I also had savvy parents with health insurance who weren't afraid to fight and advocate when they needed to. My pediatrician, when I was born, thankfully was familiar with a local clinic at North Shore Medical Center, where I attended, and which ascribed Diet for Life as the best approach for PKU. So even though many clinics in the 90s did not follow that philosophy, I grew up with Diet for Life as an expectation. And growing up in a large Italian family, it was difficult, but I am thankful that my clinic was up to date on PKU research and was definitely unafraid to change with the times and with that research as it came out. And so as new options for formula and medical foods became available, my clinic would encourage me to experiment, try what worked best for my needs and for my lifestyle. I was a very active teenager who did multiple varsity sports and danced and did theater. And I knew I wanted to go away to college. So the new pill and capsule versions of formula that came out in the early 2000s were a huge improvement because they were easily transportable. They didn't cause bloating and bad breath. And they required little to consume other than just a bottle of water. Whereas powdered formulas, which I was used to taking, they were messy to prepare. They had a really pungent odor. And unfortunately for me, they caused significant cavities, and I've had multiple root canals in my life due to their high sugar content. Unfortunately, though, I did have to fight several times for coverage of my pills with various different insurance companies. Though I live in a state now that requires coverage, many state laws are written to only require coverage for powdered formulas, even though life has been made significantly more accessible to me because of these discoveries. In terms of improving PKU treatment, I do still wish that there were more options. Some people want pills, some people want a powder, some are okay with injections, and some people want a cure. Personally, I would greatly prefer a pill over injectable forms and medications with fewer side effects. Many medications are also very wasteful with their packaging, with entire scripts of what is required in the directions in every single box for every single injection. And so that would be an important change for me as well, to see packaging be less wasteful and better for the environment. Lastly, treatments also with faster measurable benefits would encourage patients to explore their options. I can share more about my experience in the clinical trial when we get to the topic. But I will say, looking back for now, it was really only my commitment to helping others in the PKU community and really wanting to help make change and make history that caused me to stay in the study for so long, because it did take 2 full years for me to see any change in my levels while I was in the Palynziq trial. There were certainly times where I questioned if the time off from work and the effort and all of the physical pain from the symptoms were worth it. And I am not somebody with PKU who is looking for a cure, but I believe that the autonomy is important for our community. And I believe that options are incredibly important so that everybody can make the choice that is best for them. I believe it's the voice of the patients with PKU who should be driving the force of advocacy for our community, and to collectively encourage the research, the funding, and the legislation to live the lives that we deserve.
Thank you so much, Megan. You've given us a lot to think about, and I appreciate the changes you mentioned to not only medications, but the way you take your formula and what that meant in terms of, an easing of a burden of something you had to rely on day after day, and what that meant to your life. Catherine, are there any comments coming through from the online participants?
There are. We've got a few kind of focusing on the tracking fee and the protein intake. In Pennsylvania, someone said managing PKU for 2 young kids requires the full commitment of 2 adults with good executive function. We have to manage today's formula and food schedule while anticipating any challenges that might come up tomorrow. There are no days off. And then I think it was Sarah who was talking about her hope for the future with Maeve, and talking about something that isn't an injection. And we've heard that a few times from the community. One of the people, someone in Kansas, said something that is similar to Palynziq in terms of outcomes, but no need for formula, an unrestricted diet, but more easily taken, like a pill or a powder versus an injection, with less or more easily manageable side effects and a quicker response time.
Common theme there.
Very common theme.
The ease of administration and the quicker indication of whether this is something that's going to work.
And less side effects, for sure.
Less side effects, for sure. So on this topic of what matters most in an ideal treatment, I want to hear from one more panelist whose experience with PKU is similar to Saeed's from our last panel, in terms of having been away from care for 40 years and prompted to get back into the clinic by his wife, Beth. So Steve Scott, age 51, joins us from Yukon, Oklahoma. Welcome, Steve. Do you want to share kind of your experience and also your perspective on what an ideal treatment looks like?
Yeah, thanks. Appreciate it. I was born in Oklahoma, and was one of the first people that were in the state that were diagnosed with PKU through newborn screening back in the early 70s, 73 exact. At that time, my parents had never heard of PKU. And after receiving the diagnosis, my mom really became real vigilant about keeping me on a strict diet at that time. As a member of the first generation to receive early diagnosis, there wasn't a whole lot known about PKU then, but my parents were told that I could start eating typical foods after late childhood. At that time, I really discontinued my low pro diet around age 12, and so from that time until now, I've just been off diet. And so through adolescence, early adulthood, didn't really identify as someone with PKU. When I met my wife in early 20s, I told her that I had PKU. I used to have it. not really on the diet. And it was just something that I experienced as a child. We had 2 healthy children, neither of who developed PKU. So we were blessed in that realm. It certainly felt like PKU was just something of my past at that time. Beth my wife is a nurse, and she started to pick up on different behaviors that she felt were kind of abnormal as we got further along into our marriage. She was concerned about my constant fatigue, frequent headaches, trouble following different conversations. For me, that was normal. I mean, that's how I've always have been. So it didn't feel different for me. When Beth ended up investigating it further, we started hearing more about how adults with PKU should get back on diet or some form of treatment. Then we started looking for avenue with doctors around and kind of seeing what the options were around us. Through the inquiry, it spurred a series of doctor visits that led me to see a doctor who confirmed that the symptoms that she was seeing was a result of PKU. Doctor also discovered that I had an extremely rare occurrence where they could only find 1 copy of the PAH gene mutation in me. And so what they told me is like 1/1000th of the PKU population in the world is how rare that is. So that was it kind of baffled my doctors at the time as well. But the Phe levels were very high at the time. So we immediately started exploring the treatment options. I was fortunate enough to join Synlogic when it was going on. And even at the low dose that I got with Synlogic, the changes were remarkable. The headache stopped, energy returned, I felt more present, friends and family noticed the difference. For the first time in decades, I experienced what it was like to truly feel good, truly feel normal. It had been nearly 40 years since my parents took me off diet at that time. So when that trial was shut down, the symptoms returned within a few days, just like almost immediately.
Wow.
And it was, you could think about it, you feel a certain way and you start feeling good, and then it just devastating at that point. Because now I'm back to, got the headaches and all the other, symptoms. So we were determined to regain my health. So we found a new trial that my doctor that I got with, a new trial, and they introduced me to Janana. So I started that. I ended up driving to Dallas every other week because it was so backed up in Oklahoma that I started looking at all my options. And so we started going to Dallas and getting in immediately. So it was definitely worth that drive to feel better. And so now I'm anticipating the next phase of the trial and return to that renewed sense of wellness.
So for you, it sounds like the relief of the symptoms that you had come to experience as normal until you didn't have them anymore, and you wanted to return to that improved state of wellness and fewer symptoms and fewer consequences of your PKU for you.
Yeah, exactly. Because it's, when you experience something new that's different than what you have been experiencing and it's better, it's just like, I've got to get back to that. And so to truly know there is a difference, because for decades I didn't know there was a difference. I thought that's just the way it was.
Absolutely. And we heard from Dr. Harding, and then in Claire Oliver's statement, she reflected on how many adults there are like you, Steve, that have been away from care and that aren't following the low-protein diet, and just the opportunity for them to experience kind of what you've had is really meaningful, and would really be a tremendous benefit to the PKU community overall if more people could have that experience that you've had. I want to move to a topic that we've heard about throughout the day, and that's the aspect of monitoring that's so important to living with PKU. And there's a few aspects of monitoring, tracking dietary Phe and protein intake being one, and the other being tracking Phe levels in the blood. So other speakers have mentioned using a variety of methods, apps like Flock, keeping paper charts and diaries, staying within a very limited diet, rather than worrying about how much Phe is in something, you just eat the same thing over and over again. And to directly address kind of the questions about how are you tracking Phe and protein intake, we invite Brittany Murray, a metabolism nurse practitioner living with PKU, who joins us from Boston, Massachusetts. Brittany, you've got experience on this topic of monitoring from a variety of perspectives, so we're delighted to have you with us today.
Thanks for having me. So for some background, I was born in Massachusetts and picked up on newborn screening. I was my parents' first child, and this was very scary for them to hear, something they had never heard of before. And so this was really a experience that they tell me about how anxious they felt. Later, my parents actually found out that my uncle, my dad's brother, also has PKU. He has intellectual disability, and he was born before newborn screening. So his diagnosis was not known at the time of my birth. So they had, although we actually did have PKU in the family, they did not know at the time. But from a young age, I was able to see the really big difference that newborn screening can make, and just how important it is for outcomes, and what a difference it made in our
family. Yeah.
Yeah, absolutely. So, that's something that experience has stuck with me. But, I was very fortunate to grow up in the Boston area that had access to incredible care at Boston Children's. But still, even with that, there were still challenges managing PKU growing up, which I would say became the most difficult in high school and college age. I was initially managed with diet and formula for basically the first 25 years of my life. And I definitely relate to a lot of the challenges people spoke about earlier. I did try sapropterin. I was in the trials early on, but didn't have enough of a response for, any meaningful change in my diet. And then in college, I was on the tennis team and a science major in school. So I was frequently on the go and busy, which was really challenging to manage PKU when, you're busy and on the go and on the road a lot. Since I would, basically have to try to take any option that I could at restaurants and rest stops, which often was either not a lot of options or really, even if I did find something, it was sometimes impossible to accurately know how much protein was in that, since you don't really know all the ingredients in restaurants. With PKU, there's like a running joke that whenever we go out to restaurants, it's French fries and salad, those are pretty much only options. But honestly, even that can sometimes be too high in protein. So it was really challenging. And, at this point, they also had in the guidelines that it was okay to relax the Phe levels a little bit. And I still did well in school. Obviously, I graduated, but it took a lot more effort, especially knowing what I know now. It took a lot more effort than it needed to. And I would struggle with some things like focus, headaches, mood and anxiety, and some executive functioning challenges. But I did track my protein intake. I am a more moderate PKU, so I could probably have about 12 grams a day, which is good in the grand scheme of PKU. But that was still challenging, and I still had to worry about every single thing that went in my mouth, which was a constant, just something you always had at the top of your mind. So because of that, obviously I wanted something else. I participated in many different clinical trials growing up. I called myself a PKU guinea pig sometimes because I just really desperately wanted a different option. So I tried both pegvaliase and the more recent trial with sepiapterin. And when I was enrolled in these studies, I was also required to track protein and intake with very frequent diet records. But I ended up, even though I went off Palynziq to try the sepiapterin trial, but I ended up restarting Palynziq last year since it's really just the current best treatment option that I have available. Although I really relate to a lot of the, the drawbacks that other people mentioned earlier, but it has at least alleviated some of the most of the burden of the PKU diet in the sense that, I've been able to have now lower or even normal Phe levels without the need to have a restricted diet, which no other therapy can, do for me at this time. So I now no longer need to track my intake as closely, other than having the new problem of trying to make sure I have enough protein, which is, something else to wrap your head around as an adult. But obviously it's a good problem to have, but it is important for me to, make sure I do that so that my levels don't drop too low and I'm getting my nutrition now that I'm not relying on formula for that. So, it's important for me to continue to have a treatment option that allows for a normal diet, but I would hope in the future for something with less issues with it. But I at least now do not have to really track as much as I used to.
And it sounds like even though you don't have to track, you still have to think about it, and you still have to be very intentional with every choice you make in terms of your food and your intake.
Right, which I think is just part of, the fact that it was ingrained in me for the first 25 years. We were, uh, food was at the top of our mind and it was a constant worry. So, after doing that for 25 years, it doesn't just go away. And
right.
you have to now try to relearn how to eat all over again. So.
Yes. Richard's video of the egg, I think really resonates of how much you have to relearn or learn food for the first time when you're suddenly available to have more protein in your diet.
Yes,
and
I relate.
Yeah. Sarah, I wonder for you as Maeve's mom, you're kind of navigating this same change that Brittany's just described in terms of tracking maybe a wider variety of foods. How's that working for you?
Yeah, definitely our methods of tracking Phe have changed over time. Maeve does have classical PKU, so her Phe tolerance as an infant was only around 3 grams of protein. In those early days, our greatest challenges were, trying to balance breastfeeding with metabolic formula and finding the right balance and stable levels. When she was a newborn, we were given a baby scale. We were told to weigh Maeve before and after every feeding, which wasn't, all that easy. It kind of took out some of the convenience of breastfeeding. Her levels were still all over the place. So before long, her dietitian at the time suggested, based on the knowledge that she had and the approach that clinic used, that we stop feeding at the breast and feed her breast milk and formula by bottle only, just so it could be more accurately measured. And then, once her levels did kind of stabilize, we had a better idea of her tolerance. We were very particular about measuring and monitoring everything she ate. With such a low tolerance, we weren't comfortable not weighing every piece of food that contained phenylalanine and adding it up, for her daily allowance. When she became school age, it became more difficult to do that, quite to that level, and have a close watch on her. Her school was legally required to provide her with a low protein lunch option, but at that time they were just rotating three different meals, which she got tired of eating the same thing. And we did have a reporting system with the school, but we still struggled to kind of know exactly how much she was served versus how much she ate. And Maeve, she's a light eater, so if they didn't cook her school lunch to her liking, she just would come home without eating lunch. And then we were kind of stuck having to catch up, and our plan for the day had been thrown. Another factor was by second grade, she started coming home reporting that kids at school were making fun of the food that looked different or her smelly formula. So she did choose not to drink her formula at school. She still doesn't drink formula at school, which impacted kind of regular spreading of protein throughout the day. All of those factors, also with physical growth, different levels of activity, did make it difficult to constantly adjust her diet, her formula intake, and as well as balancing that with her emotional well-being. And as others have said, it didn't help that when we were worried about high Phe levels, we had to wait a week to get our male blood spot test results back. So after she started the Palynziq injections in 2023, and once she started about a little over a year, started responding to those injections, we had to start to relearn what to feed her and also the tracking. We're kind of retraining, as parents, caregivers, were retraining our brains, both on how to incorporate more protein into our diet, but also the tracking doesn't come as automatic as it used to. We'd really had the amounts kind of drilled into our brain and we had an idea of kind of what her day would look like, even without measuring. And now we have to relearn the protein contents of the new food she's eating, balance that all with her formula intake. So still a long road ahead with that. We are grateful for how far she's come and, that the possibilities that will continue to open up thanks to current treatments.
Yeah, thank you for walking us through the different sort of phases and how you had to keep tabs on things in different ways to accommodate all of those variables. And we just, one thing that's come across today in spades is you all are like math majors to keep all of these factors in dynamic circumstances in your brains and just reacting to every little difference. So you kind of led us back to this idea of testing and tracking blood Phe levels in addition to the food intake. And Meredith described in her statement the Phe level Friday. That's a little bit of a social media engagement in the community. And we've heard from so many people about this, at-home testing, the limitations of that. Eugene Lebliner is here and reflecting on the experience with his daughter Adelaide, or Addie, who we met in session 1 with his wife Kristen. And Eugene, I know you've had to deal with this through Addie's young childhood. And how are you thinking about both the measuring of blood Phe and other ways that you and Kristen sort of try to monitor her health without having real-time data to go by?
Oh, thank you for the question. Yeah, like many of the families here today, we didn't really appreciate the importance of a newborn screen until our first child, Dominic, because our first child, Dominic, was born healthy. That changed when Addie was born. Her newborn screen flagged an abnormality and within a few weeks was diagnosed with PKU. From that moment on, everything really shifted. Kristen stopped breastfeeding and we began working with a dietitian and a geneticist. We had blood draws, medical formula. There was a real learning curve. Addie was a very fragile infant. She had a very low Phe tolerance. Her genetic profile suggested that she would respond to sapropterin, though. And we started to work with her on the medication when she was only a few months old. But thankfully, while she had no side effects, it's very hard to quantify its impact. We see a lot of promising signs. She just had her Phe levels really drop and her protein tolerance increase for the first time this year. And that allows us to add more natural protein, gives us a little bit more breathing room with her food intake and her diet. But over time, we become attuned to the signs of Addie's Phe levels when they're potentially high, like when she's more irritable, when she has trouble focusing. That's when we suspect it's a spike in her Phe levels. Without the real-time data, though, we're often having to wait a week or more through blood draws for confirmation of this. In those moments, we usually adjust when we're in that kind of guessing waiting mode. We add more structure to her days. We have to lighten up her social schedule. We have to make sure that if we do suspect high Phe, like if she's ill, that we're recalibrating her diet and lowering her protein intake. And this is just really done on the fly. So it's really a constant balancing act. And now Addie is entering her adolescence. So as she's getting older, we find ourselves wondering how much of a mood issue is related to PKU symptomology and how much of it is just our daughter becoming a teenager. So looking ahead, we're very hopeful. My daughter isn't intimidated by needles. She's very eager to start Palynziq when she's old enough. We're also very excited about new treatments that have better bioavailability that are on the horizon for her, especially that she has this limited response to sapropterin. The therapies with a new mechanism of action, the promise of gene therapy or gene editing, those give us real hope. We're cautious about clinical trials at this stage, but we know that these treatments are on the horizon. So in an ideal world, Addie's treatment would be injections through something like Palynziq that would allow her to eat freely, combined with a home fee monitor, so we could real time track her fee levels and make adjustments for her, you know, with some real knowledge. When we think about the future, we also think about how having children might be an issue for Addie, and we're also eager to see research on that front as well.
And I know others join you that we've heard from today in that hope in particular, but in many of the hopes you've shared. Thank you, Jean, for sharing how you're managing this now and what you're looking forward to for Addie's future. Catherine, are there comments online from the online?
There are. We've got a lot of comments coming in regarding the home fee monitor. Larissa in New Jersey wrote, immediate fee testing would greatly help understand what might be happening with my children. My son struggles with big feelings of anger, and his teachers have asked, is it due to his PKU? And we tell them that we don't know because of the lag and turnaround time. We also heard from an anonymous viewer, continuous glucose monitoring has changed the world of diabetes, particularly as a method to understand and measure outcomes for research of new treatments and technologies that lessen the burden of disease management. A similar method of measuring blood feed levels would allow for life-changing ability to understand daily management and treatment outcomes for all individuals with PKU. So a lot of hope for the future with home monitoring.
That's for sure something that we heard from almost every single person as we prepared for this meeting. It is something that seems so immediate in terms of the unmet needs for this community. Okay, so our final discussion question of the day relates to clinical trial participation, and we heard from several of our speakers throughout the day that have had experience participating in clinical trials that have helped really advance treatment options for PKU to where they are today and where they're headed in the future. And Eugene gave us some great sort of vision towards some of the newer things on the horizon. Megan, I'll return to you to share some of the challenges you experienced as a clinical trial participant.
Sure. So to give a little bit of a background on going into the clinical trial. So um, I've always been able to manage my PKU pretty well because of the factors I was talking about before that, I had a clinic that ascribed to Diet for Life. I had parents who had health insurance and health insurance that covered my formulas and medical foods. And I was also lucky enough to find a college that was committed to providing PKU foods to me. It was really important for me to go away to college and have that experience. And unfortunately, that was a really big barrier that many colleges and universities were not prepared to accommodate somebody with PKU. But I did find one that I loved. And it made it really easy to stay on diet and take my formula while I was away from home. And while I was in college, I also decided to try Kuvan, which was already on the market at that time. But unfortunately, I was not a responder. I have classical PKU and had a pretty severe or pretty low tolerance. And so Kuvan it just didn't work for me. And unfortunately, also during that time, my geneticist retired and my dietitian changed hospitals. So it really became unmanageable for me to go to clinic. So I was kind of doing it on my own until about 3 years later when I moved up here to Western Massachusetts and found Albany Medical Center, which is actually in New York State, but is the closest PKU clinic to my home. So Albany Med, which is about an hour, a little over an hour away, were involved in the Palynziq trial. And as I learned more about the trial when I first joined them, I decided that, like I mentioned before, I really wanted to just help make history. I really wanted to be somebody who helped forward the options for our community, and I joined it. But the experience was very challenging. I had to go to the clinic every single week, which was only possible because I worked 2 blocks away from the clinic, and my clinic was really great about being flexible with the times that they were seeing me, often seeing me after the clinic hours technically had closed for the day. They also, I had to remember to keep a food journal for 3 days beforehand, which was difficult to remember. And then the extra blood draws were really, really hard. And there was one particularly difficult time where I had to be stuck 9 times before they were able to find a vein. And that is not because of the skill level of the phlebotomist, it is just the way that my body reacts when I'm getting blood draws. So that's also another call for the home fee monitor, is that sometimes our veins just don't cooperate, especially after having, 20, 30, 40 years of life of our veins being stuck, that, they get really sensitive to that. And then there were 2 things that were always drilled to us, into us during the study, and it was that we had to carry an EpiPen because we might go into anaphylactic shock, which was always really scary to think about, and that we couldn't get pregnant and we can't get anybody else pregnant. And that really added to the emotional load of just, needing another thing that needed to be controlled in our life when we're already so used to controlling so many other aspects, that it just really took a toll. I also had a large immune response to the drug while I was in the trial. I had severe joint pain and stiffness. I had really painful dermatitis that was hot to the touch through my clothing at one point, and also some really severe injection site rashes. There was also one point where my neck was so stiff that I couldn't even turn my head to look out my side view mirror when I was driving to work, which, like I mentioned before, I was 2 blocks away from Albany Med, which is over an hour away from my house. So that was a really dangerous side effect for me at the time. My levels also didn't respond for 2 years because of the incredible immune response that my body had. It was preventing my body from absorbing the drug. But then all of a sudden, my levels tanked and were actually significantly lower than therapeutic levels, which caused its own consequences. I faced a lot of confusion. My anxiety skyrocketed. I had severe hair loss. And normalizing my diet, which was something that, was the whole point of being in the trial, I didn't realize how difficult it was going to be, because there's no support to learning how to eat a typical, normal, everyday diet. And for the first time in my life, I had to get enough protein, and that's something I still struggle with to this day. I'm training for a marathon right now, so I have to eat even more protein than I normally would. And then also learning how to get healthy protein and healthy fats and healthy carbs. It's a really kind of strange transition. And it's kind of like taking on a whole new identity of a person with PKU who kind of functionally doesn't have PKU, but you still do. And it's just a really challenging system to navigate even after being in a successful trial. And then finally, just, there's always that question of how much is this therapy going to cost once it's approved? So even when you're successful in a trial, there's always that piece of it on our minds as well.
Absolutely. And a number of things that you mentioned sort of harken back to other speakers we've heard today. So it's good to have that validation of some of the challenges you experienced, both with the mechanics of the way the trial was run and also just experiencing an experimental therapy for the first time and needing additional support to make those adjustments in your life and the way you live your life with the benefit of the medicine now. Brittany, I know that you also had, you shared with us a bit about your clinical trial experience, and Claire brought up in her statement this penalty, as she framed it, of needing to have levels of 600 or higher to get into some studies. Do you want to speak to that as well?
Yeah, absolutely. And like Megan, I think it's important to know that I was fortunate to have access to great care, and was someone that was probably considered, or was considered, in good control before going into clinical trials. But even with that, I obviously still wanted to participate in these clinical trials because really, really needed and wanted a better treatment option. And I think one of the main motivating factors for me was just, for as long as I could remember, I had always dreamed of a treatment that would not require the restricted diet. So my clinic also knew that I had hoped for this because obviously I told them and was very vocal about it. So when they were enrolling for the Peg Valley's trial, I was very enthusiastically the first one enrolled at the site in Boston. And I still vividly remember, like I could tell you every detail of that day they told me I responded, like what room that I was in of the research unit, the people that came in to tell me. I mean, to this day, it still makes me emotional. So obviously I, really wanted better treatment options. And it was a whirlwind after that, as Megan described, like trying to eat new foods and trying all these foods for the first time and actually having normal Phe levels, like in the range of someone without PKU. Um, and everything came immensely easier. I was completing my master's when I was participating in that trial, and now my doctorate, and both of those have now been easier than completing my bachelor's. So, I think that just speaks to how important it was for me to participate in these. But it definitely had challenges, like we heard from Claire. The challenge of the Phe level criteria was I think it's definitely frustrating. It's frustrating feeling like you're being penalized for being under good control and really limiting a lot of patients that would be really that would benefit a lot from these trials. And then, for me, because of how desperately I wanted to be in this trial, obviously I had to unfortunately cause harm to myself essentially to get into these trials to qualify because it's something that obviously a lot of us really really want a different treatment. So the criteria is really limiting. But clinical trials are also really time consuming, as Megan described, and there's a lot of sacrifices you have to make. Like I mentioned, I was in grad school in the trial, and I wasn't able to participate. Boston wasn't the first trial site, and I wasn't able to participate until it came to Boston because it was already something that was a big time commitment, and adding a commute was just going to be too much. So I was really lucky that my grad school, I was down the street from Boston Children's, so I would literally like run over to Boston Children's with my backpack full of books to the clinical, my study visit during my lunch breaks at school, and then have to run back. And at the beginning, I was there for multiple days a week. Like Megan, had lots of blood draws, and I still have scar tissue in my vein from the amount of blood draws, and I was experiencing a lot of side effects. And so during school, I even had to run out during a final exam because I broke out in hives and had to go get Benadryl. And the frequency was obviously very challenging to maintain during being in school and being busy. And the protocols also can make it very difficult to stay in long term. Even if you get into the trial and qualify and go through all of this and go through many visits, staying in it can also be challenging. Like the frequent diet records, for example, they're pretty time consuming and difficult. And, I do my best to estimate, but there's inaccuracies, and it's a burden, especially when, your diet is stable for a long time and you're like, what is the benefit of doing these over and over again with a stable diet, especially when the literature, has shown that accuracy is very questionable. So, that was something that I think as I progressed in the clinical trial, because of how cumbersome it was, my diet records probably became even less and less accurate. Um, but then the amount of time for the Phe levels, I mean, I know people have talked about a home Phe monitor, but even just with the protocols of, some of the Phe levels had to be sent way out, even though like we have a lab at Boston Children's that could have given me a Phe level the same day. But instead I'm waiting over a month, and because of the protocol, you can't make changes to your diet. So you're suffering from symptoms of potentially higher, whatever the symptoms may be from Phe levels or anything else while you're waiting for these to come back. So I think having to follow a rigid protocol, I mean, obviously I understand from the clinician perspective having to have these protocols in place, but when they're too rigid, it unfortunately can cause harm to patients too.
Absolutely.
Yeah. So I think being on the provider side, I've been able to see that different perspective. And, my care team has obviously given me a really big influence on my career and choosing to go into this. And I love working in metabolism, which has given me this like, really different perspective. And so working with PKU on this side, I've learned that, my experience is obviously not the same as others. Everyone really has had different experiences, different perspectives. There's a large spectrum of PKU and the challenges that people have faced. But I think what's been made very clear to me, especially with all these perspectives, is that although we've had improvement in treatment options and our management, we still have significant gaps, and
Absolutely.
a lot of that has been brought up today where,
Yeah.
children, pregnancy, like just treatment options, side effects, there's a large amount of gaps that we still have to solve.
Absolutely. Thank you for all those observations and your dual role on both sides of the clinical patient equation. Catherine, is there maybe one more comment before we close out the session and then
There
go into
are.
closing comments?
Absolutely. We've had, a few comments regarding the clinical trials. And I think one that's interesting is from somebody in Colorado. And they said, managing PKU already takes up so much of my life. I don't really feel like I want to put a ton of time and energy into a clinical trial. I don't feel comfortable being a guinea pig and trying things that aren't for sure safe. So, we need people to participate, but it's not for everyone.
That's right. That's right. And I note here that we had a couple callers ready to join the conversation, and regrettably, we're just at the end of our time together.
It went
I knew
so
this
fast.
day was going to go so fast, but the callers should know that your comments have been received and will be part of the meeting record. So thank you to our last group of discussion panelists here. Is such a great opportunity to learn from you and to have you with us today. And thank you so much for sharing your experience, your aspirations, and what you hope is on the horizon. Thanks so much. So as we move into our closing session here, I'll just take a few moments to summarize today's learnings and 5 important themes that we heard across the presentations and discussions. So first, while the symptom burden of PKU is tightly correlated with continuity of good Phe control, even adults and children who follow a strict low-Phe diet and prescribed treatments experience symptoms, especially challenges with executive functioning, emotional control, anxiety, depression, headaches, joint pain, sleep disturbance, guilt, and even some shame. Next, we heard about 4 especially challenging time periods in managing PKU. First, that initial calibration of protein and Phe intake after diagnosis, and then again when solid foods are introduced. Second, the period of puberty and the transition of daily management from caregiver to teen or young adult. And then during and immediately following pregnancy, when Phe tolerance may change dramatically. And then during the later years, when the evidence for long-term effects of PKU and long-term use of low-protein synthetic diet and medications may be less well understood. The third theme was that treatment benefits are most meaningful, and these include being able to eat a more normalized diet with a wider array of natural protein and other nutrients, feeling full and experiencing joy in eating, a better overall feeling of well-being and having more energy, feeling more confident in thinking and decision-making skills, having more control over emotions, more stable Phe levels that avoid the swings from highs to lows, fewer worries about consuming Phe or protein due to poor labeling or unexpected ingredients, the reduced mental load associated with measuring and tracking Phe intake and wondering what the blood Phe level is, and then fewer PKU-related concerns about breastfeeding or childbearing. The fourth theme was the downsides of treatment that we heard frequently were the taste, texture, and high calorie and carbohydrate content of medical formula and foods, the limited number of available options for low-Phe foods, especially in rural areas and in some states and under some private medical coverage programs, the side effects that come with some of the treatments of joint pain, gastrointestinal distress, histamine reactions that may be experienced as itching or hives, rash, anaphylactic shock even, injections and site tissue scarring, the challenge of achieving an appropriate dosing schedule, especially with what can be an extended delay in experiencing treatment benefits, and then the fear of being a non-responder that then means returning to a more restrictive diet. Finally, a major challenge for individuals with PKU and caregivers alike is the need to carefully track and monitor both Phe and protein intake and Phe levels without having that real-time information from at-home monitoring devices and waiting times for data from laboratory-based testing that may stretch from days to weeks and even months in some cases. I think it was also clear from nearly every person who participated and commented today that the PKU community is extremely grateful for the advances that have been made possible by early detection and diagnosis of PKU through newborn screening, improved care guidelines that recognize the importance of diet for life, combined with appropriate medications, and the hope on the horizon for additional treatment advances that will promise more of the benefits that matter most to patients with fewer of the downsides and risks. This includes options appropriate for people at every stage of life, especially during those vulnerable periods that were highlighted today. So with that, I'll turn it over to Catherine for her closing remarks.
Thank you, Kim, for that comprehensive summary of the compelling and actionable information we heard today from so many members of the PKU community. On behalf of all of us, I want to extend our deepest gratitude to all the speakers, partners, meeting participants, and our sponsors. This meeting would truly not have been possible without your support, preparation, and involvement. Thank you to the FDA for creating this forum for patient-focused drug development and your partnership in bringing it to fruition for PKU, especially Dr. Jamie Rosenthal and Ethan Gabor, our primary contact at FDA, who guided us through the process over the past 9 months. I'll remind everyone that the recording of today's meeting is available on demand immediately at the conclusion of this program at the same link you are at now. Please share this with family and friends and other community members who could benefit from today's conversation. The comment form will remain open until June 8th, and comments we didn't have time to get to today will be part of the meeting record and the voice of the patient report that will be published late this year. This is an exciting time for the PKU community, and I could not be more proud of the work all of you have done today to illustrate and elevate patients' and caregivers' experiences, perspectives, and aspirations. You truly help to describe TruePKU.
And Catherine, with that, I'll close out today's session. Thank you for your leadership and the NPKUA's partnerships that have made this meeting possible and brought so many members of the PKU community together for active, engaged, expert participation all throughout the day. Thank you for being with us here today to bring forward the PKU community's voices and aspirations. And thank you to the entire team responsible for putting this program together. We're just the front people. There's a whole lot of people behind us supporting this meeting and making it possible. Most of all, thank you to the community members for your courage and your commitment to forge a better future for all affected by PKU. Wishing you all a relaxing evening after this most momentous day. Thanks so much.